home. I just had surgery last week.
Oh, did you?
Yeah, so I'm just kind of in a holding pattern. I'm happy. I'm just tired.
You just look like, oh my God, I don't want to be here today.
I just
We're trying to zero in, but just look at it this way. You can stay up with us tonight because we've got 501 people that are testifying.
oh my gosh. Wow, that's a lot of people.
You telling me?
Wow.
Just multiply that by 4 minutes, even though they only get 3 minutes, it takes a minute for them. And see what time tomorrow afternoon.
That's 6 o'clock tomorrow night,
Yeah, we'll be finished tomorrow.
Oh,
if people stay around.
yeah.
Madam Administrator, can we,
Just say it on there because she's not in here.
Madam Admin, oops.
Yeah, that's right.
Madam Administrator.
No,
Yeah,
you're-
you're all set. We have the recording going and we're on YouTube Live.
Okay, thank you. Thank you very much. Good morning, everybody. Good morning. We'd like to call the Appropriations Subcommittee for Elementary and Secondary Agency presenters. Today from 10 to 12, we have Teachers Retirement Board from 10 to 10:30. We have Connecticut State Library from 10:30 to 11. And then we have Office of Early Childhood from 11 to 12. At 1 o'clock, we pick up again with the Connecticut Technical Education and Career System. From 1:30 to 3, we have Connecticut State Department of Education. And then beginning at 4 o'clock, we will begin our public hearing where we will hear from 501 of our best friends who are focused on education in the state of Connecticut. So I ask all my colleagues and all my friends and all of my advocates to swear with me that they will raise their hand and say, I will stay with you until tomorrow afternoon at 6. So with that, we will, don't laugh, anybody. We want the public to be part of this. And the most important thing is that we give everybody access and we hear their issues. So thank you, and ask my co-chair, does she have anything to say?
No, I just think that those who are on their phones need to mute themselves so that we can get right into questions for the TRB. And we're going to actually move along fast, so we might not actually be there for a full half hour or hour with anybody, but we'll see.
Yes, we will. Good. Good afternoon. Oh, shoot, I've already jumped to afternoon. Good morning. Good morning, ma'am. Good morning, Helen. Would you like to begin your testimony?
Sure. I would just like to take a moment and introduce Bob Ribeira, who is the new fiscal manager at Teachers Retirement Board. He's on the call as well. I would just like to start off by thanking everyone for funding the health plan and the pension system, and for providing the additional 3 positions we requested to get us up to our appropriated staffing level for the budget years 24 and 25. I would just like to update everyone and let them know that we are moving forward to the core transition. The bond committee approved the bond, and it's going to be a 2-year project with phase 1 and phase 2. So we're very excited about that. So we can just take it away for questions, and Bob and I are here.
Thank you. And could you explain the additional staff, the additional members to the board, please, for everybody to understand exactly what you requested?
We are appropriated for 27 staff, and our staffing levels have been no more than 23 for the past several years. So for the 24-25 budget, we were provided the additional positions that we needed to bring our staffing levels up to the appropriated 27 that we are allocated.
Okay, thank you. And for those people who are also listening in, to understand that the Teachers Retirement Board represents the retired teachers from all the school districts in the state of Connecticut. Is that correct?
Yes, Rep. Walker.
Thank you. All right. Senator Austin.
Thank you very much, Madam Chair. And so, Helen, I want to talk about the health plan. And how many health plans do you have right now for retired teachers?
We offer 2 health plans. The base plan is the Medicare Advantage plan with almost 28,000, and the Medicare supplement plan is at 4,500. The board felt that we would still offer that Medicare supplement plan for those who would like to pay the cost differential. Our Medicare Advantage plan, effective July 1, 2022, we integrated the Medicare Advantage plan to include the prescription drug plan. Our plans are, we both have Medicare Advantage plans, the state of Connecticut and the Teachers Retirement Board. We
So
do
Helen-
offer, yeah.
I'm sorry, go ahead, continue.
No, that's okay. Again, we're continuing to offer that Medicare supplement plan for those members who would like to remain and pay the cost differential.
And what is the cost differential between the two plans?
It's probably the Medicare Advantage, I believe, is 83 for with dental, and the Medicare sup is 326. And all of our plans are bundled, so it includes
83, I think we need to understand what that means. 83 per month, 83
Yes,
per day, 83 what?
it's an $83 a month premium and a $326 premium for the Medicare supplement.
And the Connecticut General Statute requires a cost sharing arrangement in which retirees, the state, and the TRB health plan each pay 1/3 of the total cost for the basic plan.
Yes, yes.
And the basic plan is the $83.
Yep, that is the Medicare Advantage program through United Healthcare.
And right now, is the budget set up so that we are paying 1/3, 1/3, and 1/3?
Yes. Mm-hmm.
And the Medicare supplemental plan, is that on the same 1/3, 1/3, and 1/3?
Yes. Mm-hmm.
And are we paying 1/3,
No,
1/3?
we're the Medicare, everybody gets the same 1/3. Statute dictates that the Medicare Advantage plan is the base plan. So, so those folks who decided to remain on the Medicare supplement plan are paying the cost differential.
So they get, we are paying 1/3 of the base plan for all the 28,000 plus the 4,500. And we are the relative to the sorry about that, just switching around. Relative to the 4,500, they get the equal amount that the 28,000 because they chose to say on the other plan. Is that true?
Yes, yes. Yes, yes, they do.
Okay, so because they made the choice to stay there, do they have the ability to move into the Medicare Advantage plan should they choose to come out of the Medicare supplemental plan?
Yes, there is. We have annual open enrollment every year in September, October, and November to allow members to make a choice.
So the additional funding that was in the governor's budget, is that funding relative to the base plan?
Yes. Mm-hmm.
Okay. And on the Teachers Retirement Board, how many people are on the Teachers Retirement Board?
There is a total of 14 members.
Yep. And what is the makeup of those members? Are any of them retired teachers?
Yes, we have 2 retired teachers, 4 active teachers. I believe there's 5 ex officios, and then the rest are appointed by the governor. There's 1 seat that is vacant on the board, and that is the municipal seat.
So you have 2 retired teachers, 4 active teachers, 5 ex officios, and that would be 9, 10, 11. That would be 3 appointments by the governor.
I believe there's a total of 5, and I believe there's 1 vacant. I'll have to look that up for you.
So that's more than 14, though.
Yeah, I'll have to look that up for you. I don't remember everyone's position.
Because if the governor has 5, then that doesn't add up to 14, because unless the 5 ex officios don't count as the total of 14.
Yep, they do. I'll have to look that up for you, Senator Austin.
Okay, great. Thank you for that. Thank you, Madam Chair.
Thank you. Are there any other questions from Representative Felipe?
Not sure if you have it on hand, but I would love to, just going off of what Senator Austin was asking about, get the racial and ethnic breakdown, as well as how many are male, how many are female on that board. Thank you, Madam Chair.
Thank you. Are there any other questions for the Teachers Retirement Board? If not, thank you very much, and we look forward to talking with you in the subcommittee. Thank you. Have a
You
good-
got it. Thank you. Thanks.
Okay, so we are now ahead of the clock, but if the Connecticut State Library. Oh, they're here. Yay. Perfect. Good morning. And would you do us a favor and first turn on the button so that little red light comes on? There we go. And then secondly, please state your name.
Good morning, everyone. I am
Bring the
Deb-
microphone close to you because CTN is not going to be able to get that sound.
Is this better?
A little bit better, just a little bit closer. Go ahead.
Good morning, everyone. I am Deborah Schonder, the Connecticut State Librarian. All right. So let me just start out by saying thank you to the governor and OPM for the appropriation. This is impacting the Connecticut Digital Library, which is one of our appropriated funds. Just to give the committee a little bit of background about the state library's budget, our budget has been reduced 32% since 2009. And without the proposed increase, we will not be able to meet contractual obligations to meet some of the costs related to our Research It program, which I'll go into a little more detail. And also just to give you a little bit of further information, the current appropriation in this line is just over $1.5 million. If we did a cost benefit analysis for how this benefits libraries across the state on an annual basis, it would cost public libraries $41 million each if they were providing those individual services that we are able to provide to them through the state library. This is an exemplar of resource sharing and equitable access to information, regardless of financial status or wealth across the state. In addition, there is a direct correlation between the number of resources we can afford to offer through our Research It program and savings to municipalities, including those you represent. 32% of public libraries rely exclusively or almost entirely on the resources that we provide through this appropriation. And with even additional information, with additional appropriations, we could provide more resources, including direct support to K-12 schools, ebooks and e-audiobooks for those with reading and learning disabilities. And we could also enhance interlibrary loan services across the state and increase workforce and lifelong learning development. So with that, I would be happy to answer any questions from the committee about our budget.
Thank you very much, Deb. So I'd like to talk a little bit about the Library for the Blind.
Sure.
You know that this is a passion of mine, and I
It
don't
is.
see an increase in those services for the Library of the Blind for the blind. What is your plan to increase the services for the blind constituents across the state?
Absolutely. So last year, thanks to you, we did see an increased appropriation to that budget. And here's a couple of the things that we have spent that funding on this year. We purchased studio software and magnifying devices in order to enhance services for patrons and to provide a local recording of talking books here in Connecticut, which we support. We also updated Braille signage in our library. We're also adding storage within our facility to better service the repair of the equipments that our patrons use. And we're also implementing a new hub library program. This is 10 public libraries across the state who are piloting a program with us to be local access points to visitors who want to learn more about the Library for the Blind and services that we have. So those are just a couple of the things that we have purchased so far, and we intend to do that. In addition to kind of direct expenditures, the library is thriving under its new director. We have seen an increase in 435 new patrons just this year. That's
For the Library for the Blind?
Yes, for the Library for the Blind. Currently, we have 5,405 active patrons. Those are patrons who've checked out at least one resource this year with us. And that increase in patrons is the most we've seen since FY19. We have circulated a total of nearly 190,000 items just this year alone to those patrons. We have conducted 62 outreach visits that reached nearly 700 new patrons, including for veterans, for senior centers, for groups across the state, including public libraries, to learn more about the resources. And we've been connecting with those groups. We have re-implemented a newsletter that hadn't been offered for several years, and it's being available now every 2 months rather than every 3 months, and it is provided in a variety of accessible formats. We have also been working with our federal partner, the National Library Service. They have implemented a new e-Braille reader system, and we currently have 30 to 40 patrons currently using that on a regular basis.
So can you stop there for a minute?
Sure.
What do you mean by an e-Braille system?
So this would be, as you're aware, physical Braille books are fairly large and someone runs their fingers across
Right.
to read them. This is a device in which it actually refreshes it as somebody runs their finger over a device. So it's much smaller and easier to use, and they go directly to patrons. And so they're able to, rather than receive a large stack of books to read physically, they have a device that they can run their finger across, and it refreshes with each line.
And it has the ability to have that raised indentation on an electronic system.
Yes, that's correct.
Okay. I didn't mean to interrupt, but I wanted to make sure I understood what an e-Braille system was.
Absolutely. It's new. So good question.
And who is on the advisory board for the Library for the Blind?
Sure. We currently have 10 members, 7 of whom are either individuals who are currently patrons or are eligible for services. And they include representation from across the state, including the local chapter of the Federation for the Blind, the Lions Low Vision Club, the State Educational Resource Center, patrons and veterans as well. It's a broad scope of people.
And the other three are?
That would include some of those who are patrons.
And can you send us the list of members and
Absolutely.
whether or not they have cited issues?
Of course.
So we can see how many are actually people who have the cited issues. Madam Administrator, I'm sorry,
Thank you.
Sue, not you, Madam Chairman.
Yes, thank you. Can you tell me, how is the Connecticut card payments? How is that going? And are we still very vibrant in that process? And explain what Connecticut card is so that people understand.
Absolutely. So Connecticut Card is actually currently called Delivery. It went through rebranding a number of years ago, but this is the way in which we reimburse public libraries for distributing library materials across the state. So Connecticut is very unique in that if you have a library card for one library in the state, you can walk into any other public library in the state, check out a material, or you could request to have those materials delivered to your local library. So that's the delivery system. The Connecticut Card system has been unfortunately cut in funding over the years. And currently it is at about, I believe, $800,000 a year. And what that is the reimbursement that goes to public libraries for the costs of lending those materials, the staff time, the materials that would go into it, regardless of the delivery itself of the items. And unfortunately, that is less than 20% of the cost, 20 cents to $1 on the cost of that lending. So we actually have libraries in the state who are at the point of either saying they have already given up on the program because it costs more to participate than to not participate, or who are at the point of considering letting it go. So an increased funding in that line would allow us directly to reimburse libraries for the work that they do in this. This is, I think, the most beloved of the services that we offer and the way that we reach the most patrons across the state.
Thank you. And I remember the senator during that time from New Haven was a strong avid supporter, Senator Harp. She fought very hard for that program. And I remember a lot of the people wrote to her about it because they did travel, because they worked in different areas. So it helped them to be able to still utilize the libraries and at that. And I think that's something that we should look and try.
I would
So you're
appreciate
saying
that.
it's only 20% of the cost?
Currently, yes.
All right, okay. Are there any other questions? Questions? Go. Representative Nuccia.
Thank you, Madam Chair. And thank you for coming today.
You're welcome.
This is new to me, so I'm glad you kind of gave an overview. I'm going to be 100% honest. I didn't even know we had a state library.
You were not the first person who's told me that. so.
Well, I think that's a miss on our part. I hate to bring up personal anecdotal stuff, but my best friend lives in Nashville and they
Mhm.
have a massive library that
Yes.
is just used throughout the entire state. And it's very easy to access. And I always said, I don't even think we have a state library.
They
They're
have a
all
beautiful
local
new
little
state library.
libraries.
Yeah, I lived in Nashville for several years, so
Oh, so you're familiar
I'm
with it.
familiar.
They
Yes.
have an amazing library down
is
there. I'm
amazing.
quite jealous. So now that I know you're here, though, I literally just applied for a card. I didn't even know. Okay.
Fantastic. I love it.
So I'm wondering if you could expand a little bit. You've got about $100,000 in here added for the cost of digital library
Mhm.
contracts. And I know we see a lot now, especially with the schools after COVID, with the one-to-one devices and all of that stuff, is more availability of kids to have books, right?
Yes.
And I know we have a small local library and they have a really good selection, but a lot of times you go on and there's not a lot of digital stuff, like the digital resources, or it's one book and you got to wait, 6 months to get it, kind of a thing.
Yeah.
So what are you doing in that arena? Because I noticed there's an increase in here, and how do you utilize that asset throughout the entire state for the library?
That is a great question. In particular, in general about the library service generally, but specifically about schools. So in this case, school libraries often are very underfunded if they're not cut at all. And so one of the ways that we provide this service, and we have been focusing on, is trying to make up that gap within our local schools. We currently have recently implemented a community shares program through this appropriation, and we are serving 101 schools across the state with resources that are coming to them. This would be resources related to our All Connecticut Reads program, our Kid Governor program, and databases and resources. In my written testimony, I also include some information about some of these resources that go to schools, but 101 schools is not all of them. And so this is actually our top priority should we receive additional appropriation, because you can't hurt to ask. If we had additional appropriation beyond even what is proposed here, our first priority would be reaching out to every school in Connecticut so that they would have not only the baseline, but increased access to materials.
What does that ask look like?
I would say when this program started, it was appropriated for $2 million for the program overall. We're currently at about 1.5, and that was 10 years ago without inflation. So that gives you some idea of what we could do with increases to this line.
So you're currently at 1.5. Okay. And then I'm not familiar with the Connecticut card payment. Can you Can you tell me a little bit about that? I'm sorry. I'm just doing this because we're ahead of time and I'm edifying myself here.
I like it. I used to be a teacher, so I like that. Yes, so the Connecticut card program is part of a delivery service, statewide delivery service that we offer. So anyone in Connecticut can borrow a book from any other public library, any academic library that loans to them as well. And so the Connecticut card portion of it is the reimbursement of the costs of that service to the local libraries that are sharing their materials. We also provide, the state library provides the delivery service that actually routes those books across the state. We provide with state and federal funding, the manpower that actually provides that services, but the Connecticut card reimbursement is directly for the local cost to the library to essentially participate in the program.
That's good to know, because I know we do have, you can borrow from other areas. I'm going to ask you a question now. I don't know if you'll have the answer to, but do you know if Yukon Library is part of this or is that separate?
I don't know off the top of my head. I know that we do have a number of university libraries that are participating, but I can check if you would like that.
Okay, because on a side note, I do have a bill in to have Yukon's library be opened to the public because it is the largest library that I am aware of.
And I
in the
did see
state.
that bill, so I would be happy to talk with you about it. And I know that the system office for the Connecticut State Library, or libraries and universities, colleges and universities, is in conversation with this. And many of the academic libraries do provide lending. They may have public hours, they may have public access. It depends on the library and the university's policies itself, but we can double check on Yukon.
Thank you very much
You're welcome.
for your answers. I appreciate it.
Are there any other questions here? I have just a couple more.
Sure.
You have, you have, according to the budget sheet, so you have 53 staff. Do you have 53 staff, or is that a number that is budgeted into your account, but you are trying to come up to that position? So how many staff do you actually have in full-time and in part-time?
In appropriated funds through the general fund, we have 53. Currently, we have 8 vacancies and are actively refilling those. Some of them, we just hired a new director of our museum who has been starting. We also are about to conduct interviews for, I believe, 5 other positions, and several have been approved for refill. So we're actively recruiting for refilling all of those positions. If you take into account all of our funds, full and part-time personnel, we have 84 people when fully staffed.
84 people fully staffed. Is that 84 full-time and part-time?
That's full and part-time.
So how many part-time people do you have?
We have 13 part-time, let me pull this up for you, that are paid out of the general fund. And the remainder, which is 18 positions, are paid for out of other lines such as federal dollars, grants, things like that.
So you have 18 staff members that are paid out of other funds outside of the general fund.
Correct.
And those would be are those federal funds?
Some of them are federal, some of them are related to the Historic Documents Preservation Fund, which is state funding. It depends on the particular position.
Okay, so you do have federal, but then you have other entities in the general budget that in the state budget that cover the costs for the remainder of those
Yes, for 3 positions.
for 3 positions. Okay. All right. Yep. Okay.
Can you break that down and bring it to the subcommittee on how many positions you have and where the funds come from?
Absolutely.
Thank you. Representative McCarty?
Thank you very much, Madam Chair.
Good
and
morning.
Good morning. Welcome to the appropriations hearing. Thank you very much. I know the libraries have done tremendous work over the years and really appreciate what you do. The one area that I noticed that stays static, and I don't know too much about it, is the Library for the Blind. Are you able to just expand a little bit about that, what that and how that money is used?
Absolutely. So the Library for the Blind is a unique service that we offer. It is in partnership with the National Library Service for the Blind from the Library of Congress. And this is a network of libraries across the nation and across the world that provide services to those who are blind and print disabled. And in that case, they've actually recently updated the federal regulations to allow those with reading disabilities, for example, to participate in the program, expanding the reach of the program. And most of the materials that we provide and the backbone of the service is provided through the federal program and federal dollars. The federal government in-kind and direct appropriation supports about $150 million per year for this program. And you'll see that we have fairly limited numbers within our budget. Essentially, that is because the federal program provides so much of that service. The local dollars we use to support local programming. So we are implementing a new hub library program, which will take this service and information about it to local libraries so that people can visit more closely than just our one centralized location. We support a nonprofit that does recordings for Connecticut specific titles. So most of the materials that we receive from the federal government are general reading. They're available in multiple languages, but they may not necessarily be recording Connecticut books. And so a local nonprofit that we work with does local recording. And so we help support them with some new software to have that and have a recording studio here. There are several recording studios. And so we also support repair of the equipment. The equipment is provided by the federal government, but we do local repairs on them to send them back out to members. So the bulk of the decisions about the program and the funding are from our federal partner, but we work in conjunction with them and we essentially provide the staffing and the local contacts for our patrons so that they have somebody in Connecticut that they can talk to. When a patron calls or contacts us about wanting to know about a book that they want to read, say, they like mystery books, they call up, they talk to somebody in Middletown who can say, here are some books that I recommend to you, so they have that local contact. So that's just a quick overview, and I would be happy to answer further questions.
No, I just think it's so important that we address every group and to help those that are blind is very important. And just one, because the figure has stayed the same for a long period of time. And maybe at some other point, you might be able to send some recommendations to us, how you think we might be able to improve and what more we could possibly do in that arena.
Okay, thank you.
Thank you.
Absolutely.
Thank you. Representative Porter.
Thank
Good morning.
you, Madam Chair.
Good
and
morning.
Good morning. Quick question. I want to go back to, you were talking about the Community Shares Program. I know that New Haven, has been reported to me that we have about 10 school libraries that are non-existent. So I want to know if there are any of those schools, any of the 10 schools that don't currently have school libraries participating in this Community Shares Program. And if they're not, I would love to find out how we can make that happen.
I
Um,
don't know the answer off the top of my head, but I will look into it and get back to you. Absolutely.
Thank you. And that's really important because in my district, in our district, I will speak for New Haven in general. We definitely have a school reading literacy issue. Children not reading on grade level, especially by age level 3. And that is problematic. So if there's any way that we can get these schools the libraries that they need and deserve to help these children have a place where they can actually, bolster their literacy, that would be great.
Absolutely.
The
And-
other, Mhm.
no, I interrupted you. Go right ahead.
No, you go ahead.
I was going to say, this brings us back to what the representative was asking earlier about not knowing that there's a state library. People feel like that about many libraries, and school libraries in particular are impacted in that way. Funding and support for school libraries across the country has gone down over the past many years. It is off. I used to work for somebody who said the first place I look to cut is the library and IT. And they said that directly to my face, and they are not alone in that opinion. People don't see the benefit of libraries. They don't understand what a library can do. People assume that libraries are physical books, old dusty physical books, and they are programs, they are community hubs, they are places where students can come and access the materials that they can't afford at home, don't have at home, may not have even known that there was available, and they're able to speak with somebody who keeps their questions confidential, who can give them advice and talk with them about ideas. My first library card gave me such a feeling of independence, and that I have never forgotten. And that is what we want to provide for students, and the ways that we can support our school libraries, our public libraries is absolutely vital, and helping people understand what those libraries do today, not just
Mhm.
what people think that they do or used to do, is incredibly important. And New Haven, Bridgeport, we have so many towns where there are people who cannot afford resources, don't have access to them. I was working in an academic library at the start of the pandemic, and we had students who just said, I just need you to be open so I have a place to go.
Mhm.
That is the minimum I need, but please, I don't have that any other way. And we can just go on from there. So I would love to continue talking with you about this.
Absolutely. I look forward to that conversation. I too can remember as a kid. I mean, I grew up in a 3-bedroom apartment with 7 individuals in it. So it wasn't exactly the quiet space you would need to concentrate. And the school library was my haven. That's where I
Exactly.
went when I needed that time. But I mean, fast forward to just a rent cap press conference we had the other day where we had young people testify that, it's cold in my apartment. We don't have heat. When I come home from school, I go to the library. This is where I'm able to stay warm and study, and my mind can function. So I'm looking at my district, and there's actually talk of closing a library
Yes.
in Southern Hampton. So that's disturbing to me, because I don't think we realize it's not just the children, it's also the seniors who come and use those laptops and those books, and they're able to do the things that they need to do because, like you said, they can't afford it. They don't have what they need at home to get done what needs to be done.
Absolutely.
So I'm going to end on this. I have one last question through you, Madam Chair. You talked about the 10 locations that are participating in the library for the blind. And I was just interested to know if you knew those off the top of your head. And if you did not, if you would be able to supply us with those 10 locations in the subcommittee.
I'm double checking to see this if I have my notes. I believe Hamden is a location, but I will double check and get you that list.
Thank you so much. And thank you, Madam Chair.
Thank you. Representative Felipe.
Thank you, Madam Chair. And I really appreciate this brief education on the state library. I don't think we've had this in my, this is my 30 years subcommittee chair, and I don't think we've heard this before. But I think something important that I would like to ask about is maybe just a brief education on the statewide digital library and what that does for access.
Absolutely. So the statewide digital library is one of our longtime appropriated funds. And in this case, it provides services for 5 key areas. So one is the Research It databases that I was talking about just a moment ago that we share with local schools. Anyone can access this from a public library, from their home, any location where they can access the internet. We also provide interlibrary loan services. So we built and support the catalog and the infrastructure that allows libraries to communicate their materials to each other. So it's a centralized location where people can go and find out what libraries have, what books that they can borrow across the state. And then we also support ebooks and e-audiobooks in addition to that. So as we saw, particularly during the pandemic, the rise in the use of e-materials has increased significantly. And what we haven't seen is even as libraries and patrons have returned to physical books, the usage rates have remained high for both physical materials and electronic materials. And this is also an equity issue. This is an accessibility issue for people who say, my eyes aren't good enough. I can't read the script and I want to be able to blow up the text. I hear better than I read. I would like to be able to listen to audiobooks. So one of the things that we do with the digital library is we provide about 23,000 items to any resident in Connecticut that they can access for free through their public library because of this. Primarily, it's backlist titles, and the local libraries, which are funded at a municipal level, provide kind of the popular current release titles. But that is something that we provide and could increase if we had additional funding. As you may or may not know, the cost of ebooks and e-materials for libraries is significantly higher than it is for the consumer market. So the costs that libraries are being asked to pay for the same resources are much higher, 6 times higher in many cases. And libraries are subjected to restrictive loan material items. And so, for example, a library could purchase a physical book, keep it on their shelf until it falls apart in 60 years or 100 years. An ebook typically expires after 2 years or 26 checkouts. So essentially, taxpayer dollars are being spent to buy these materials that disappear from a virtual shelf after 2 years. We do have another bill, SB 500, that's trying to address that issue. But that is one of the ways. That was a lengthy answer to your question, but it's those 5 key areas. Was that a good overview, or do you like more information?
No, that was perfect. And I think,
Okay.
the point I was kind of trying to get you to drive at, which you did perfectly, is good representative to my right was talking about having that safe space, and that the library was her safe space. But there are a lot of folks with our new focus on mental health, especially for mental health of children, that are in positions where they have to be at home, or they have to be somewhere that's safe for them, somewhere that's isolated, and the access to the ebooks, the audiobooks, and being able to take some of these materials home really make that possible for them to have
Absolutely.
their own safe space. So
Yes. And
I'm glad that we provide that.
And I apologize, I interrupted you. I absolutely agree. And we see that with both physical and electronic resources. Some people may not be able to get in there. In terms of physical collections, we had a book on mental health in one of my libraries, and we had patrons say, can you put this in a more secluded corner so that people can't see that I am even just looking at this book on the shelf? And one of the things that electronic resources do is it means no one else can see what you're looking at, even as you're reading in any location. So there is a privacy and a confidentiality aspect to it, not just the general accessibility aspect. So I think it's a great question. Thank you.
Thank you, and thank you, Madam Chair.
Thank you. Are there any other questions from the committee? Thank you, and thank you very much. We had a good chance to get to know our library a little bit better, and now we
Absolutely.
create more questions, but thank you for your.
I would be happy to answer them. One of the things that I've been in as the state librarian about 2 years now, and one of the things I have been doing is trying to raise awareness of what the state library is and how we support not only our libraries across the state, but state government too. So I would be happy to have conversations with anybody who's interested.
And we will do that. Thank you.
Thank you all.
Have a good day. We are well ahead of our schedule right now, so I think what we'll do is we'll just do a recess until 11 because the next one is the Office of Early Childhood and they are at 11. And so I give everybody a few minutes to stretch. Thank you. We are recessing. Good morning, everybody. Good morning. I'd like to call the appropriations budget for elementary and secondary education state agencies back to order. We now are going into the 11 o'clock hour with our Office of Early Childhood Education. Good morning, ma'am. Good morning.
Good morning, Representative Walker. How are you today?
Oh, it's a beautiful day in the neighborhood.
Hello, Senator Austin. Good to see you.
Go right ahead, ma'am.
Well, good morning, Senator Austin, Representative Walker, Senator Berthel, Representative Nuccio, subcommittee members McCrory, Felipe, McCarty, and distinguished members of the Appropriations Committee. I'm Beth Bai. I'm the Commissioner of the Office of Early Childhood. You have my testimony, and as I've been briefed, I'm not going to read the testimony. I did want to make two quick corrections based on my rereading of it today. One is under the child care apprenticeship funds, the 6.5 million. I had said OEC had rolled out more than 2 million in agency ARPA fundings, but Millie Torres Ferguson updated me this morning, and that's 4 million that we've rolled out in. It's
Page
on
3.
page 4 of my testimony.
Page 3.
The other update I'd like to make is on page 4, the $30 million school readiness grant funds, is that after meeting with the Early Childhood Caucus this week, we're looking to simplify that. I'm happy to tell you what's happening now in some of the changes we're considering to simplify that administratively. It's turning out to be a real burden on the towns. I'm sorry, the meeting was with the school readiness liaisons this week. So we're looking to simplify that. But besides that, everything else still holds true, and I'm happy to answer questions about our budget.
Well, thank you. And since you opened up that part, why don't you go right into it first? Well, let me do appropriately what our standard questions are first.
Sure.
Standard questions, you have, according to the budget sheets, you have 118 staff. How many of those are filled positions and how many are not filled?
Yeah, thank you for that question. And those are state appropriated positions. I don't have a breakdown, and I will get it to the committee and the work group about the 118, how many of the state approved positions, but I can tell you I was updated yesterday. We have filled 27 positions since May. We have 34 openings right now at the office, to give you a sense of where we are on hiring, and we'll get you very specifics around the state appropriated positions and the federally funded positions, because we have more like 160 people when you add the federal folks in. So we'll give you the whole breakdown.
Yeah, so we'd like to know how many are federally funded and how many of them are state funded.
Sure,
We'd like to know how many are full-time, how many are part-time,
sure.
and the other would be any of the ones that had retired and are come back
Yes,
on
we have
on
several of
limited
those.
access,
Mhm.
so that we know exactly. I mean, having 34 in vacancies that you has got to be putting a major burden on your staff and the people of Connecticut who are counting on you for that type of support in many areas. What is the area that you have the least the most openings right now that you're looking at?
We have openings in grants and contracts, because you'll remember in last year's budget, we expanded that. And fiscal, we have 2 fiscal lead positions open now that are currently posted or will post within the week.
What I'm sorry, what was it? Leap?
Fiscal leads.
Oh, fiscal
So
leads. Mhm.
supervising accountant and a fiscal administrative supervisor. Given, that we've tripled the amount of funds running through the agency, grants and contracts and fiscal have had the most pressure, I would say, to move all of that through. And we've had the support of OPM and DAS to add positions. We had your support last year to add positions as well. So we've been adding those, but we haven't completed that.
I hear, not for nothing, but I think in the education agencies that we have, the fiscal issue is a very common theme in all of them, because I think SDE has some problems in it. I believe the technical high schools have some. So it's very interesting that the educational agencies are the ones that are sort of in need in that area. So now I want to go back to what you
Sure.
started with. You started, you talked about the 4.5 million in the child care apprenticeship funds and then the 30 million. Could you expand on both of those for us? Because those were some of the areas that we were
Yes.
looking at.
Well, and appropriately so. I mean, I think this body knows that the workforce is the biggest challenge in the field right now. And both our qualified staff member structure, the whole early childhood structure in higher ed, lead to what is too long a pathway to join early childhood. So we have funded $4.2 million in workforce pipelines in New London, Norwalk, Meriden, Hartford, Bridgeport, New Haven, West Haven, and Westport. And we have about 200 enrollees who are cohorts going through the process. Now, Representative Walker, I was lucky to meet 3 of them when I visited Circle in New Haven. So they're getting that background in child development, direct classroom experience, and getting paid by this program while they train. And that's really been a missing piece as we've been trying to bring people on. There are other programs in Norwalk and Bridgeport that are working with the high schools to start CDA programs in the high school and then bring those students right on board. So these are pilots. And then the legislature assigned $6.5 million as well in fiscal relief. And so we're going to use these 8 models to expand to probably more micro cross-state efforts to help some of our programs train their own staff, because 200 is really good, but we have thousands of openings. And so working with CSCU, working with the education committee to change our qualified staff member requirements, and then creating a much shorter pathway into the field, we think is the way to go, but there's work to do.
Okay. And on the, well, first I want to say, I'm glad to hear that that is working. I saw firsthand same locations and Georgia and that group, they've done a great job. And the students that I met were fantastic. The fear is they're going to really like it so well. They're going to keep going on and get their bachelor's, and then they're going to go into the K-12 system and leave the early childhood, which is a huge dilemma, but I'll let my other colleagues, I'm sure, will touch on that. The $30 million for school readiness. Can you explain what are you simplifying in that system?
Sure. We're looking to work with our team and the school readiness liaisons to see, and the child daycare programs to see how we can make that simpler. What we're doing now, which we think made sense, is during the pandemic, programs were getting a 25% enrollment grant that they simply help them cover the loss of students and enrollment in the state funded program. On average, in our priority districts, to talk in old language, they're short about 20% of the students. So that's a big hit on the budget, both from the state funding, the parent fees, and Care for Kids. They're not getting any of those funds for that 20%. In the competitive districts, the rim suburbs and schools that have towns that have 1 or 2 Title I schools, they're 96% full. So we're still seeing a real differential impact on programs in our priority district. So the enrollment grants are meant to fill in as well. But what we did was we tied it to enrollment. So you basically got a bonus per enrolled child, but that creates, and we're doing that, and we've gotten through the contracts and all that takes months to done. So now they'll be paid quarterly. But because the amounts change quarterly, then they have to go through their local council sometime and get a new vote. And so we're looking at how we did enrollment grants, and we'll work with the liaisons to figure out, is there a way we can make these grants less burdensome? Because I was speaking with one town where the programs haven't gotten any of the funds yet because the city hasn't approved the funding that came to them. So we learned that we need to make this simpler. And then the idea is in fiscal year 24, the second 15 million will go out to continue to subsidize the programs. And then the next year in 2025, the governor added 15 million permanently into the school readiness rates, so that versus these one-time grants, it will be ongoing, and staff can and directors can plan compensation, et cetera, knowing that that number's increased permanently.
So just to clarify also, these are for state operated.
These are state
These
funded.
are not the independent ones
Nope.
that I'm gonna hope that somebody's gonna ask about that so that I don't occupy, but I
Use
think,
your question on that.
yeah, because I think that's another. So I'm gonna go to some questions. I got my couple in there and then I'll come back. Senator Austin.
Thank you very much, Madam Chair, and good morning.
Good morning.
So just a question on a technical issue. In the Office of Early Childhood budget, we have early childcare provider stabilization payments. And 50 million was taken out on the governor side, and then early childcare provider stabilization payments, $50 million was put back in. Is there a difference in the two? Why is that like that?
No, the 50 million, there was 50 million and then 20 million, I believe, in carry forward.
50 and 50,
Mhm.
general fund.
The way, and what document are you looking at, Senator?
The OFA budget sheets.
Okay, the OFA budget sheets. I don't have those in front of me. I'm sure Maggie can get them to me, but here is the intent of the budget, is that 50 million, as OFA has put in their write-up, was meant as one-time wage supports for programs. Those are funded in this fiscal year and they will be out before the deadline. Thanks.
Say it again now.
The 50 million in wage supports was in the budget as a one-time 1-year payment process, which we are in the process of getting the second payment out right now. There's a webinar this morning helping programs prepare for that.
That was the 50 million that we put in
Yep.
last year in the budget.
Mhm.
Yes. And so that is still going out.
That is still going out.
And then
First
you-
round's out,
And
second
then
round's
you
going.
put it in, the agency requested it to be in 24 and 25. And then the governor recommended to take it out, but then you look 2 lines down and it's back in again. So what's the
I
difference?
think there might be an error here as I look at it. The 50 million in stabilization payments was meant to be one time. That I don't know why that's listed under agency requested. Those funds are removed. And then from those funds, there's about 14 million in 24, and I believe it's 52 million in 25 to account for the increase in care for kids. And the governor assigned 35 million in
So I'm gonna
state
have-
fiscal relief.
Thank you, because I'm going to
to
have
fill in.
OFA check into that
Sure.
because that's not what the governor had in his actual numbers. And so his numbers show a $50 million early childcare provider stabilization payment. He did not have an increase in care for kids. I know he talked about an increase in care for kids, but he does have I'm sorry, the governor did recommend an increase in care for kids in year 1 and year 2. But the 50 million is also there still. So you're saying that 50 million shouldn't be there, that the increase is in year 1 was 14 million.
It's 14 million for care for kids. I can get you the exact number.
In year 2.
And then in year 2, it's 50, I think it's 52 million in that range. Hold on, I'll find it for you.
Yeah, that's what I'm trying to get.
And it's 52 and
So if you go to my testimony,
Yep.
in care for kids, top of page 2, you'll see there's a 14.2 million increase in 24 and a 53.3 million increase in 25.
So that 50 million is an extra 50 million that I have to spend. Is that what you're telling me?
That's what I'm hearing.
I can go through that before the work group, but I certainly did not believe there was 50 million still in that line item. I believed it got shifted to care for kids increases. And then in year 1, the governor added 35 million in federal relief funds to make that,
That's
you know,
ARPA dollars. so
35,
Yeah,
yeah,
I
the
have that.
35 and the 14
I
get
have
just
that.
about to 50.
That's why I figured he didn't have it all in year 1 because he was using ARPA dollars.
Mhm.
But we could, if it is in fact true that $50 million is still there, then we could make it, rather than ARPA, we could make it care for kids, have it corrected to a general fund expenditure. That's the governor's
Senator, that's up,
intent.
and that's up to you. The governor's intent is what I explained, and that was our intent
Yep.
as well.
Yeah. So So everybody was really excited when the governor talked about an increase in Care for Kids, and I think Care for Kids can always use an increase. Is there a wait list for Care for Kids?
Not at this time, Senator. March 1st, the plan is to implement an enrollment management system, which could place folks on a wait list, but that was the point of the 35 million. Without the 35 million in ARPA relief, then we would have been moving from about 21,000 children on Care for Kids down to 17,000 over the next 12 months. But because of the 35 million, we'll be moving from about 20,000 down to about 19,600, understanding that people come in and
Sure.
out of Care for Kids all the time.
Right. So let me understand this. You have Care for Kids
Mhm.
that has 21,000 kids in it right now.
Mhm.
And we're giving you another $50 million and we're going to see a decrease in the number of kids using Care for Kids?
There are a couple things at work here.
Okay,
First of all, we had 15,000 in 2019. The ARPA funds, the governor thought it was really important to support both families and programs to make Care for Kids widely available. We added workforce development, which in the past, Representative Walker will recall, had like a $30 million fiscal note. We're finding it costs way less than that to keep Care for Kids open to people and working. So we expanded eligibility, which brought more families on, which got us to, I think Julie can probably tell me, we're like at 20,600 right now. Yes. 20,600 children now. So to avoid a steep cliff, that is why the governor added additional dollars
so I'm,
to try to continue to serve more families with Care for Kids.
I don't mean to be obtuse, but
No.
I have 59 million in Care for Kids right now
Mhm.
in FY 23 appropriation. And in that 59 million is 20,900 or 600 children, correct?
Well, that plus all the federal relief dollars, the governor signed about $120 million in federal relief to keep Care for Kids open over the past 2.5 years. For workforce
where did that-
development, for 50 to 60% of SMI.
So where did that $120 million come from?
That came from OEC received American Rescue Plan and
That went
coronavirus
directly
relief.
to,
It went directly to Care for Kids.
went directly to OEC.
Yep, directly to OEC. So we used it's not the state fiscal relief, but the OEC funds
Yeah.
to expand eligibility. And the other thing missing, Senator, just as you think about the numbers, is a 10% increase in Care for Kids across the board for all providers is essential. There's always that balance of rates and access. And this is certainly the biggest increase Care for Kids has seen in my time as an early childhood advocate. And that means providers are getting paid more per child. So that impacts the bottom line.
And for the 73 million that you have in year one under the governor, you will have how many kids? 19,200?
We'll be moving toward 19,500.
19,500.
So it's about 1,000 fewer children.
And what happens to those fewer kids?
Well, what happens is as families apply when there's enrollment management, TANF families will get right in, teen parents will get right in, there'll be presumptive eligibility. Families under 50% of SMI are likely to get in. We have to follow the categories. The families that will be waiting are in what we call like tiers 8, 9, and 10, which are 50 to 60% of SMI, and also workforce development, adult ed, higher ed, and workforce training.
And in FY 25, how many kids will we have in for 112 million?
The plan is in fiscal year 25 to come down closer to 18,500.
So for
Yeah.
I don't, we put in more money and we have less kids.
What happens is the rates escalate because if you go 10% on top of 10%, then the rates drive it from the first year costing 14 million. The second year, the rates cost 52 million. That's a rate increase.
So can you send us a chart on that?
Sure.
That outlines all of that, because on the face of it, it makes no sense to me. And then I'm going to ask you the perpetual question that I ask you. We have a childcare desert in Eastern Connecticut. I've talked to you every year that you've been commissioner.
Mhm.
I've invited you down, you've come down, you've
Yep.
talked to them. We still have a childcare desert. We are going to see 20,000 new workers just for electric boat, 20,000 new workers. The number one thing that they're having a legislative breakfast on I think it's Monday morning or tomorrow morning. I don't know which day it is, because our schedules are so completely crazy right now. They're going to tell us how many kids they have
Mhm.
that are, then they're now paying insurance for from 0 to 5. The number goes up every year, but we still don't have any childcare down in Eastern Connecticut. And every year you tell me we're working on it, but I still don't see what we're working on. So I took it on myself to go to the YMCA and ask them if they would come down to the area. And they will. They're still waiting for a call from OEC to talk about having childcare for Eastern Connecticut. Not only will we have 20,000 new workers at Electric Boat, we have an increase of 2 subs at the sub base. That's going to bring in kids and families for those sailors that are assigned to those 2 new subs. And then we have all the subcontractors. There's some 400 subcontractors that are associated with Electric Boat that all have young people working for them that want to have children. They don't qualify for Cared for Kids because they're just above the market rate. So none of them get anything. So can we figure out how can I get a commitment from you that we are going to make a #1 priority after 4 years, that we're going to get some childcare centers in Eastern Connecticut to take care of this issue? Because it's not fair. Not fair for those workers. They need to go to work.
Yeah,
And-
Senator
and
Austin, I appreciate the question and I agree it's a big challenge in Eastern Connecticut. I would say that our office has been working very hard to stabilize the industry and have gotten tens of millions of dollars to Eastern Connecticut and all over the state to do that. I'll also say that we have worked that the funds that you assigned for facility and for new infant toddler spaces will advantage childcare deserts in the RFP and RFA process. Working with UConn, I sent some materials to your office to show that we are not just counting social vulnerability now, we are counting childcare desert score. And for example, in Eastern Connecticut, I can tell you where the deserts, who is the highest. Wyndham, New London, and Norwich are all in the top tier. So they will be advantaged in every RFP process for facility funds and for new slots. So that's one way we're working with the current dollars.
Yeah, I appreciate that. We've been waiting 4 years and we still don't have the assistance that we need. And we have a massive increase in workers coming into the area.
Mhm.
So I just want to make sure that because I've asked nicely, really nicely for a lot of years now. Now I'm going to start pushing it because it's not, we need workers to take those jobs. The federal government the Navy is saying to Electric Boat, can you make our contracts?
Mhm.
And they're saying that because they don't believe that we can, because we can't bring the workforce here. We can't bring the workforce here in part because of this childcare desert. And we want to keep those contracts here in Connecticut because they provide good blue class
Yep.
jobs.
Yes.
My next question is relative to birth to 3.
Yep.
And so in talking to the birth to 3 providers, they got none of the increases in their pay when we put the minimum wage increases. Do you know what's going on with the providers for birth to 3? Why are they not seeing that increase?
Yes, I may ask Sarah Poulin to come up and explain Sarah Poulin's our fiscal director, to explain which programs got the COLA and which programs did not, because this is a problem for agencies like OEC that has programs funded through different means. So Sarah, just introduce yourself and explain the COLA calculations and what happens with birth to 3.
Turn on the microphone and give us your name, please, before you start to get into the testimony. Go ahead.
Hi, my name is Sarah Poulin. I'm the fiscal administrator 2 for the Office of Early Childhood. With the COLAs, it was for private providers, and there's a difference with fee for service based providers. So the birth to 3 providers weren't eligible for the COLAs because they have a completely different calculation.
I'm sorry, I can't hear you, and I'm not certain I understand that.
So the birth to 3 providers are a fee for service based provider system. They're not like they're private providers, but they're not calculated in the same way as our contracted private providers. So in the way that the legislation was written, or the guidelines were written for the COLAs, they weren't eligible.
So what would the legislation have to say to make them eligible? Because we were under the impression and told that they were eligible. And this is the first time we're hearing this, so.
We can work with OPM's attorneys and our attorney Cynthia Watts-Elder, who's here, and get you what part of the language makes them ineligible, but we worked closely with OPM on figuring out who was and who wasn't eligible.
So we were looking for legislation to make sure that they are eligible. So we want you to tell us what you need us to say in writing, in legislation, to make them eligible, because it's unacceptable to us that providers for birth to 3, a critical piece of early childhood, is not getting those increases in payments, and we're losing birth to 3 providers because they're not getting paid what they should get paid.
Yeah, will do.
Thank you. Appreciate it. Thank you, Madam Chair. I'll have other questions later.
Thank you. Representative Nucci.
Thank you, Madam Chair. First, before I get to my 2 of about 50 questions, because they're big on this 2-question thing. I'm going to just elaborate a little bit on what Kathy was saying, which is not a question. Looking at the money that's in there for the Care for Kids, I find this really quite concerning. The number that's in there now is $2,889 per kid. And what we're saying is by the end of 2025, we're going to be paying $6,098 per child, less children. I really want to understand what this program is doing and how we're justifying 111% increase for less kids. So that I think is a subcommittee thing, because I think it's probably
Okay.
a lot more
Well,
complicated.
Yeah,
than-
we'll bring that, but just very quickly, Connecticut's paying between 30 and 40% of the market rate for childcare. The system is fractured. It's not working. People can't make a living at it. The feds who fund Care for Kids in large part are asking all states to get to 75% of the market rate. And Connecticut's far from that. The 10% a year gets us started there. But we will bring details to the work group about the increases and what it means in terms of payment rates and access and enrollment.
I'm an accountant, so I look at these things from like a numbers perspective, and I hate to say it, but if we're talking about the pay rates and all of that, if you're looking to bring this up 75%, you're increasing the cost of care, right? So we're going to only be supplementing certain people, and that's going to affect the next class and the next class and the next class all the way up, because kids are kids and they all need care. So I'm concerned with the fact that we're bringing this budget up so high for less amount of kids, and that is going to spill over. As Kathy said, there are so many people out there, I told the story yesterday, like that are $1 over the limit that get absolutely no help. So we're increasing the cost for all of these people across the board. So that just means to me the fundamental system is broken, right? Because if we have to pay so much more for this here, there is no we. It is all of us. We're all paying that. And now whether or not the state is going to supplement my income to do it, or they're going to supplement your income to do it, it's an increase across the board. We're making it more expensive. So we have to look at how we do this in a way that's going to actually be beneficial and is not going to create bigger problems. And 111% increase in state funding for this that's a big number. That wasn't a question. My question though is.
I didn't mean to answer it.
No, it's okay. Exactly. All right. So I actually have quite a few questions in this area. I'm going to get together a list to send to you guys.
Sure.
But I'm wondering if you could give a little bit of information specifically here on, we were just talking about the birth to fee and eliminating parent fees for birth to 3 program. What does that mean? Who and what, like, how does that?
For most of the history of birth to 3 in Connecticut, there were no parent fees. If a child qualified, meaning, they're for the most part 2 standard deviations from where they're expected to be developmentally, and they received services, those are an entitlement, and the child would receive those services in the home or at the childcare center from birth to age 3. About, I don't know, Representative Walker maybe knows the exact year, but maybe 6 or 7 years ago, we instituted a parent fee based on income. And we did see a drop off in participation in birth to 3 across all income bands. And there were concerns that children were missing out on what are critical early childhood interventions. And so the legislature and the governor decided to suspend parent fees for a period of time. And this budget annualizes that.
And it suspends it permanently.
Permanently.
All right, so this is for like the birth to 3 kids who have developmental needs.
Yes.
Those services.
Identified, yeah.
Okay. And then the next question that I have is around the gap payments
Yep.
for birth to 3. So I'm trying to kind of accumulate all of these birth to 3 things. So if we're eliminating the fees of the parents, what is the enhanced gap payment for birth to 3?
The legislature assigned funding last year for this year and next year for I believe it's fiscal year 23 and 24. I'm just looking for confirmation. Yes. And that was intended to help birth to 3 providers recruit staff, and because they're having, much like the rest of the workforce, having real workforce issues, and they need real specialists. And so the legislature and the governor approved a budget to enhance that, while OEC conducted a rate study and also investigated how to leverage Medicaid dollars, additional Medicaid dollars for birth to 3 services. And that study is in process right now. So gap payment is not, if you will, sort of an equitable distribution. It's just an amount given for children who have fewer hours to help programs maintain their administration and pay their staff. So it was a temporary fix, always intended to help them through the pandemic and support them. But then long-term, we will use a rate study and what we learn about Medicaid reimbursements for a longer-term fix.
Okay, so this is basically filling out the year 24 and then removing that allocation for 25.
Yes.
Okay. That's 2. I didn't know we were limited to 2 in these. Later, that's okay. Yep, I'm good. Thank you very much.
Thank you, Madam Chair. I'm glad I'm going because all of my colleagues have taken all of my questions, but not to worry.
I
Commissioner,
bet you
how
have
are
a few left.
I think I do. Commissioner, the Connecticut Insider, the Greenwich Times, the Stanford Advocate have had headlines over the last few weeks. And I'll just read to you the headline from the CT Insider. It said, Connecticut's childcare industry is being squeezed as never before, but the warning signs were there. 962 family-based programs closed over the last few years. 905 center-based programs have closed over the last few years. 24% of those closed, and the reason that they gave was because of career change. And 81% of those that closed gave their reasoning for closing was because it was not profitable for them anymore. Now, we're talking about 90% of a child's brain that's being developed in these early years. And your department and those who work in your industry are obviously doing a great deal of work to help really start off the workforce for our entire state, creating a more resilient economy and also a more resilient population for us in the future. Now, we've been talking about care for kids, but I also want to talk about what's been brought up to me from folks in my district who run center-based programs and also some home-based programs, not care for kids, but just the overall reimbursement rate. Because what happens is that the current reimbursement rate, and I don't have that off the top of my head, I think it's 7,000, right about $8,000 per child. That current reimbursement rate is well below the market rate, as you've shared with us, which means that these private programs, center-based programs, have to then subsidize that cost and raise millions of dollars to help not only pay for their teachers and staff, most of them who are making about $32,000 a year, most of them who are women of color or women in general. So can you just tell us what can we do to address the problem in terms of the reimbursement rate versus Care for Kids? Because they're not the same. If you can explain that as well for folks watching at home so that they understand what the differences are.
Sure. First of all, just to comment on the closures, there have been closures. What we have seen is a stabilization funding reduce the proportion of closures over the past 3 years. That those, as you said, the problems were severe before the pandemic. The stabilization funding helped, but now that stabilization funding is going away. So we anticipate the curve to, continue. So on the rate side, you've just heard me talking with Representative Nuccio about the Care for Kids rate increase of 10% a year for 2 years. That's helpful for, as you've all pointed out, a subsection. In terms of state funded, last year, the governor increased the infant toddler rate for state funded programs by more than $4,000. I think it was per child. It was about an 80% increase in that rate. But $13,500 does not cover the full cost of infant toddler care. You have to combine that with Care for Kids for the families that are on Care for Kids, and then you get close to the full cost equality with the increases in the infant toddler per child Care for Kids rate. On the preschool rates, those have barely gone up since 1997 when the program was introduced. This year, the governor proposed an increase to $10,500. It was a 17 to 18% increase. Helpful, not sufficient.
Right.
Those also need to be combined with Care for Kids funding for families enrolled. And then there are parent fees. I think the other piece of the puzzle is the governor really wants business to come to the table and pay a share as well, which is part of you and I had a back and forth about it the other day, the tax relief for programs that subsidize childcare. Like Senator Austin was talking about Eastern Connecticut. We had talked to Electric Boat about they were interested in building their own childcare center. They decided not to because of the cost. The governor's putting out something there that may help organizations like that have more incentives to get in the game and put some of their own funding into the system. So this problem requires a federal response. We were expecting about $280 million from Build Back Better had that passed. Instead, we're getting about 13 million. Rosa DeLauro fought hard for it, as did others, but it didn't make it across. But it needs that kind of national approach. What the governor's trying to do here is increase the state-funded approaches, but at least 70% of childcare is entirely private. It's private pay. There's some that are making big profits in Connecticut who are charging more, some of the larger corporate childcare programs. But for the most part, programs are struggling. Private, public. The public programs, the private programs complain that the public got all those 25% in stabilization and enrollment grants while they continue to struggle. But I think it is important to realize that it's mostly a private market.
Right.
And the state can't control the private market, but we can pay a fairer share of the full cost, which is what the governor's trying to do with the Care for Kids and school readiness and child daycare increases.
I have one other question, Madam Chair, if I might. The other issue, so you hit the nail right on top of its head. We're talking about the child care stabilization payments, which obviously are a one-time payment.
Mm-hmm.
And that one-time payment's not going to keep many in this industry working in this industry. In fact, we're hearing that a lot of people are leaving the child care industry to go work at Walmart, Target, and Amazon for more money. So what are we looking at post the stabilization payments to help, one, increase the workforce for this industry, and also maintaining and making it sustainable for them to stay there?
Yeah, I really appreciate that question. One thing on the stabilization front, and I'm working with Elena Truworthy, our new deputy commissioner on this, is the governor has asked us to assign the 17 more million of our stabilization funds to the highest need centers and the highest desert areas, because you've heard me say they're still down enrollment 20%. So we're going to use social vulnerability index and get another 17 million in stabilization out now. That doesn't solve the long-term structural problems of childcare. That is, parents can't afford to pay the full cost of quality, and quality's linked to the workforce.
Right.
So we have the workforce training programs, we have workforce recruitment payments, but the bottom line is it's about compensation. It's what got me into advocacy and the Stamford Office Park in 1998 picketing for fair wages. And it's still the core issue now. Early childhood providers working in public schools are making a living wage, and there are, that's probably 20% of the workforce. But if you think about that, that has a local tax help too.
Right.
So right now it's mostly state funds, federal funds, parents, and then these emergency funds. The local piece helps with the publicly funded preschool that takes some childcare, and obviously school functions as childcare for older children as well. But the governor believes business needs to be at the table, and Smart Start was designed to see as an experiment to see if we share it with communities, will they participate? And those slots are sold out as well. So municipalities with incentives have been willing
Right.
to add capacity.
I don't disagree with you that private industry should be there, but let me just once again reiterate, we need to take care of those who are doing the work right now before we lose them.
Yep.
And I will say this time and time again in closing, if we don't get early childhood education right, we don't get ECE right, anything else that we do in the state will not matter. And so I just want us to be really vigilant about how we go after making sure that we're arming ourselves with a stronger workforce and caring for these kids, and thus therefore helping parents get back to work.
I'm
Thank you,
so
Madam Chair.
grateful for your advocacy, Representative.
Thank you. Representative McCarty. And if
Thank-
there are any people that are on Zoom and they have questions like Representative Exum who raised their hand, please raise your hand so that we can recognize you. Thank you. Go right ahead, ma'am.
Thank you very much, Madam Chair, and welcome, Commissioner. It's good to see you
You too,
again
Representative.
today. I know how hard your office has been working to make childcare affordable to as many families, and you showed a lot of flexibility
Mhm.
last year in raising that median income and looking at percentage. So that's just a comment. Just wanted to
That won't
Th-
count, Representative.
thank you for all
I'll
of that.
pretend I have my
Th-
former seat.
Thank- Just wanted to recognize that your office is focused in on those families that need that help. But in your testimony, and I was unaware of the study, you mentioned a study that you're doing with the Yukon to really address the infant toddler spaces, which is a big issue as we've discovered. And again, thank you for your flexibility with the early readiness program reading to look at what we can do to fill more slots, answering Senator Austin's concerns. But could you just comment about that? It looked like a substantial amount of money.
Yep.
So if you could just describe what you plan to
Sure.
obtain from that study.
Well, first of all, we really have the legislature to thank for this. This is Senator
Yeah.
Fonfara's idea that he was really interested in investing in early childhood, and said to me, where's the biggest problem? And we explained the infant toddler shortage. And he wants better data about the impact on children, on their school readiness, the impact on families if they have childcare available in those first 3 years, on their economic security, et cetera. So the legislature, working with OPM, assigned $20 million that we'll use over the next 4 years to study the impact of infant toddler childcare. And the good fortune here is it also aligns with our releasing 1,300 infant toddler spaces. And so Yukon is helping us plan a study with a couple of different interventions to see what makes the biggest difference. And we're also in conversations with a national research organization, because this is such a unique situation where we can randomly assign new classrooms to treatments, if you will. including, one treatment, for example, we're looking at working with UConn is a home visiting intervention that every infant and toddler in this whatever group will receive home visiting, and see the impact of that compared to families that didn't receive home visiting, because that is a federal program that's federally funded, and we could look at how can we work with home visiting and childcare together. We're also working with a national research organization around language environments and supporting teachers and families in enhancing children's early language environments as another, if you will, control in the study. So this, it's an exciting opportunity, and national folks are noting. And we hope that what we can come to the legislature with is, so what was the impact of those investments? We've been investing in early childhood as a state for a long time. We don't have a great data system. We're working to improve it, but this gives us a chance to study very specific state-funded programs and what's the impact long-term for children and families.
If I may, so this is a long-term.
It's a 4-year
it's a-
funding
yeah.
now, but we will be seeking federal funds to follow the children for years to come.
Okay, thank you for that. And then just if I may briefly, because I know we've talked about programs, so I'm trying to
Mhm.
just look at the funding piece of the family network and and by the way, if I may, the parent cabinet, I think your department was very wise to really include parents in looking at policy and going forward. And I'm very pleased to see that that's working in many regions in the state. So just, that's a comment on the nurturing family and the nurturing network. Could
The
you
home
just-
visiting.
The home, can you just talk a little bit more about how that functions?
Yes, home visiting exists in every region of the state, and children are identified, or families are identified as at risk. And if they're identified as at risk, and they receive home visiting from an interventionist, we have several different models, parents as teachers, child first, depending on the needs of the child. And then those services are delivered, and the family may stay on several months, or they may stay on a year, depending on the family need.
Okay, so it looks, if I'm looking at the budget correctly, that that area has been reduced, the funding in that.
Yeah,
item.
this is probably a theme you're seeing in appropriations. We were able to, when we went to RFP several years ago and reallocated funding across the regions equitably, there were a couple of regions that would have seen cuts and in services at the height of the pandemic. And so we assigned some federal relief dollars to home visiting to fill in. And now we're going out for new contracts. And what we're doing is assessing, we're going to be getting additional federal dollars. We have some leftover dollars. So we're looking, and we also have performance metrics. We know programs that are high performing and programs that maybe haven't enrolled as many children as they had hoped to. And so being fiscally responsible, we're looking at that. And we will assign new contracts that will match the budget.
Great, thank you very much.
Yep.
Thank you. Who is on your parent cabinet?
The parent cabinet was designed by parents. They're parents with young children. And after it was designed, they interviewed, they have 2 from each DCF region of the state. About, I don't know, probably 60 parents interviewed, and 12 were selected to serve. And I can have Elena Trueworthy come explain in more detail how that happened. But
No,
we're
but
trying to get a regional representation, a racial representation, that so we represent the whole state.
So racially, you also have the demographics of it
Yes.
too? I think that we would like to have it. She doesn't have to explain. I just.
Okay,
we just-
we'll bring
yeah,
information
we just
about
like
the
to have,
selection process.
That,
the work.
and do
Thank you, Elena.
Thank you. We'll get to, do you have lapses in any of your accounts?
This year,
Mhm.
I certainly expect we'll have a lapse in the early childhood education line item because of I've talked about the under enrollment there.
Okay.
I will say some of that will be used for the infant toddler startup, because those are new state funded spaces and programs are getting startup funds, but I still expect a significant lapse there. We usually lapse $1 million to $2 million because we fund for full enrollment, but you never have completely full enrollment. But this year it'll be significantly more than that.
And you talked about Child First. Are we
Mhm.
funding Child First?
Child First is one of the contractors in home visiting, yes. And there was also like an earmark for them with relief funds that is with DCF. So we try to work collaboratively with DCF.
Have you looked at some of the materials that they have identified in how they evaluated themselves? Did you look at any of those?
The RCT study,
Yeah,
yes.
well, because I had a real question about, so they, in Child First, it's a proven results in their thing, and they say 64% decrease in maternal depression or mental health problems. I asked them, how do you prove that?
Mhm.
And that they didn't have an answer.
I will say, just want to be really clear that Child First is for the deepest end of the ocean. It costs, and I'd have to ask Ashley, but 3 to 4 times more than most home visiting models, but it's
Yeah.
really designed for the families that need the deep intervention. And so we have some of those for the families that need the most intervention. Most of our home visiting programs are light touch that we then direct into.
I
deeper and-
got that, but my concern is, I mean, we're in approach, and I hate to say this, but I think we're all on the same, we're into data
Yeah.
and understanding, and how do we prove the successes that many of our providers claim. And when I met with them and they gave me this, I said, 68% decrease in child language problems. How do you define that? I mean, they gave me all these things, and I said, these are not definable. I mean, you have to give me some real concrete. So I would really like to have a very clear understanding of what we're spending in Child First, what they're doing, where they are, and how are we, as the state of Connecticut, evaluating their services. Quality assurance has to be in everybody's contract now. And
Yeah.
you're going to hear that from us over and over and over again, because we don't have the same amount of money that we did before. We've got to make sure that they're reaching the people that we need, not because they have supposedly a national outcome. We don't care as much about the national as it is Connecticut. So for us, we need to have, I'm sorry, we just need to have more of the specifics. And then we need to see how are we looking at that. So I just wanted to point that out.
Representative, can I just say one quick
Sure.
thing?
Mhm.
Home visiting is the place where at OEC, we're doing active contract managing, and all programs are rated on 8 different metrics. And that you heard me talk with Representative McCarty, and that has implications for your future contracts, the performance. So we'll bring our rate card to
Please.
you.
We will.
And because I do think my goal for the year is to get this across more programs at OEC, because we really see the contractors pay attention
Mhm.
if you're clear with them about the goals, and we offer funding if you reach all your goals. So we'll bring you information on
I will
that.
say that most of the people that I've talked to have said that Birth to 3 did the best, and it's nationally known.
Yeah.
But yet we don't seem to support it as much as other states. And yet we have an organization that I don't particularly support, because I still can't figure out how they are evaluating. So I just want to bring that up. So, but go on, because I got still people,
That's
and
it.
we got to go. Representative Exum, go right ahead, ma'am.
Hi, good morning. Thank you so much, Madam Chair, and good to see you, Commissioner Bai.
Hi,
I just-
Representative.
Hi, how are you?
Good.
And so much of this, the questions that I've had have been answered. I do want to, though, ask, thinking about the impact of the pandemic, and we've seen it in so many ways. When it comes, though, to diagnoses around IDD, looking at developmental delays, has there been an increase that you've been able to see? What has been the impact that has been that you've seen at this point in time? Has that been captured?
I appreciate that question. You should know Representative Exum was the chair of the School Readiness Council when I was a liaison. So you and Jillian Gilchrist, look at you now.
Go way back.
To the state capitol. I'm going to ask Nicole Cosette to come up, who keeps our data for Birth to 3, and Ashley McAuliffe is here, who manages that program. But Nicole's usually the one who's doing the data for Ashley and me, and talk about changes in identification over the past several years.
Sure. Thank you.
Just introduce yourself and turn on your.
Good morning. I'm Nicole Cosette. I'm the Part C coordinator in Connecticut. And we have seen an increase in the families that we're supporting in the Birth to 3 program. In terms of point in time data, we have increased the active IFSPs on the first of the month pretty tremendously over the last couple of years. As of 2/1/23, we were supporting 6,917 children who had an active IFSP. And if you look at previous years, that is up about 1,000. So pre-pandemic, we were supporting about 5,500 IFSPs, and now we're seeing close to 7,000.
If I may ask what IFSP
I
mean?
apologize. Yes, an individualized family service plan. So every eligible child in our system has a plan developed to outline their supports. So that includes what they will have in terms of PT, OT, speech and language pathology, developmental therapy, etc. And we have seen an increase. So that is the number of children who are actively receiving supports in our system. Our referral data has
Can I just add one thing just for context? I think for those of you who follow public schools, the IFSP is the equivalent of an IEP. So it means a child has an identified special education need by Connecticut standards. Each state has different standards.
Thank you.
And then we've also seen an increase in our referrals, and our eligibility rate is still about 65%. So we are seeing the same number of children or the same percentage of children being determined eligible in the system as the referrals go up. So we're supporting more children.
And where is that reflected in the budget? Like under what line item is
we have a birth to 3 line item
under that?
And you'll see in my testimony, Representative, that birth to 3 is an entitlement. And so these numbers do move, and when they move, we are required to meet the amounts required to meet those children's special education needs. Like with home visiting, we're analyzing exactly what's going to come in federally as well. And some of this depends on Medicaid, because we have payments are from the appropriation you see in front of you and from Medicaid. Are those reflected in the Medicaid budget, Nicole? They must be.
I believe they are. We do bill Medicaid. We are a fee for service, so we are billing Medicaid and private insurance.
Okay.
And this was a change the legislature made to try to share some of the costs with Medicaid. So it's not as simple as the bottom line before you, but I think the important thing to say to Appropes is that it's an entitlement. So we have to fund it. And so we've come to the FAC in the past to move money from one line item to another when there's a deficit in birth to 3, because we have to cover that. And even through the budget process, OPM asks us for updates on enrollment and costs, et cetera. And so you may find that adapts over the course of the session.
Thank you so much. And later, when we have the subcommittee meeting, I am, of course, interested in hearing more about the parent cabinet as well. That's also an area that I think is really important. And I just want to echo what was said before. You know, we know around the investment early on in early childhood, what it pays off in dividends later. I know the statistic used to be, $7 for every $1 invested. I don't know if that's currently where we are, but it's vitally important. So thank you for the work that you're doing on this. I know that it will continue to be a challenge, and I look forward to learning more. Thank you so much, Madam Chair.
Okay, thank you. Okay.
Thank you, Representative Felipe.
Thank you, Madam Chair. Thank you, Madam Commissioner, for joining us. I
Sure.
know in my time here, there have been many constants to this conversation, many we've heard already. But one that we're gonna miss is former Senator Mary Abrams always asking birth to 3 questions. So I'm gonna take over for her this year.
Sure.
My first question is about here you talk about the gap payment and the study that you're doing. If you guys didn't know that the commissioner was a former legislator, we love studies. She loves studies. What is the timeline for that study? Because I know it has to do with next year's allocation.
I'll give you my understanding, and then Ashley and Nicole will come raise your hand if I need to change it. We are going to contract now on the study. It's an outside agency that will do this, has done it for multiple states. And then we'll begin to get information in the summer about what we're seeing in Connecticut in terms of what are the rates that will support the system that's needed to support the children and families. As the price for physical therapists go up, the price for occupational therapists, for interventionists go up. This study will account for those changes in wages and working conditions. And I'm sure you're going to hear from birth to three providers about the challenges they have there. And then we'll have a sort of an interim report in the fall and a final report in December, January. Is that okay? I did it right.
Awesome. And my second question, just following up, Chairwoman Walker hit the nail on the head when she talked about birth to three being one of the programs that we see working and just having really, really good outcomes. But around the space, we've heard people trying to expand it to birth to five.
Mhm.
Is there anything within that study or just in anything you're doing within your department that supports a move to that?
Yeah, that is not part of this study. The study is about birth to three. I think, it would be good for the legislature, and certainly we'll be listening for people that think maybe the system should be adapted or changed. I know other states have birth to five systems, and I think there are pros and cons. I would say at OEC, our strongest brand is birth to three. They are our happiest families. They are responsive to family needs, and many of our parent cabinet members actually come from birth to three because they have such an active parent organization. So one of the strengths of the birth to five system, if it would keep the family at the center, services would be delivered, families have a hard time when they shift to the public schools sometimes because, they're very limited hours. And if families are working, it's hard to get their kids to 4 hours at PT in the public schools in the middle of the morning. Other public schools actually have their 3 to 5 year old early interventionists in community-based settings, and that's easier. So a lot of it depends on what's happening locally. But I know in Maine, where they have this system, they have a tremendous lack of preschool in childcare deserts. So in Connecticut, in communities that have had childcare deserts, very often those superintendents add public preschool so that the kids have some preschool. They fund that in part with the Part B funds, which are the 3 to 5 year old special education federal IDEA funds. So if you pulled the special education funding out of the public schools for the 3 and 4 year olds, it would reduce access, particularly in areas that have access issues in those deserts. And that's what's happened in Maine. There just aren't childcare and preschool options in the rural parts of Maine. Even though they're birth to five services, the birth to five providers have a hard time finding playgroups and preschools and childcares for the 3 to 5 year olds to get socialization experiences. So, there are pros and cons to it. So I leave that to the legislature to listen to public comment. But I'm just telling you some of the cons. And I think we work really well with SDE and Commissioner Russell Tucker. And there's a bill right now before the Children's Committee to try to make that transition smoother. This legislature passed funding to stop the multiple transitions before preschool, and we are now funding summer birth to three, even after the child turns 3, so that they can have a smooth transition to the public school. So we're doing some things to smooth the rough parts.
Yeah, I appreciate that. And I think, one of the things we look at when we have these things happen in other states is the fact that they've made those mistakes means we don't have to.
Yeah.
So
Yeah.
hopefully we can continue this conversation.
Yep.
Thank you, Madam Chair.
Sure.
Thank you. Okay, it is 12 o'clock. It's after 12 o'clock. We're supposed to be concluding. So I have 1, 2, 3, 4 people more that have questions. So I'm going to say,
I'll answer quickly.
no.
Okay.
We're going to get that information
Okay.
so they can ask their questions, but you will provide
Got it,
us
at
with
the
that
work group.
information at the work group so that we make.
I don't
sure
want
we
to get
still
between you and lunch.
All right, I have more questions. All right, Tammy, I'm sorry, Representative.
Thank you, Madam Chair. So the questions that I'm going to want to understand when we go forward is I want to understand the increase in childcare contract rates, what specifically that is in 2025. And we haven't really talked about, and I don't see it spiked out anywhere in the budget, but the early care and education line is going from 160 million to 190 million. So I would like to understand what that $30 million increase is and
Sure.
what exactly early care and education is.
Entails, yeah, what's in that
Yes.
line item? Sure.
Yes.
But thank you.
Thank you.
Okay, Representative Paris.
Thank you, Madam Chair. Commissioner, if you could just provide me with more information regarding the geographic breakdown of childcare deserts in the state, and then also demographic breakdown of those in the industry by race and gender, that'd be quite helpful. Thank you.
Thank you. Senator Austin.
Thank you. And if you could bring, you said that the birth to three was the stalwart program that you had in OEC. And in year one of the governor's budget, it's at 31 million, and in year two, it's at 25 million. So why are we cutting 6 million out of a program that's the stalwart program? If you could bring that information to the committee, that would be great.
Thank you. Representative McCarty.
Thank you, Madam Chair. And just very quickly, if it'd be possible, I think it would be interesting if we could see which programs you have some federal funding matched to and which ones may be required by federal law to comply with them. That would be helpful.
Okay, we'll bring them matching and maintenance of efforts
Right.
programs. Sure.
Thank you, Commissioner.
Are there any other questions from the committee? Okay, well, thank you.
Thank you.
Thank you.
Good to see everybody.
Yeah, good to see you too.
Bye.
Bye-bye. Thank you. Thank you all. So we will recess for 1 hour and we will reconvene at 1 o'clock, where we will have Connecticut Technical Education and Career System and then Connecticut State Department of Education. Thank you.
How you doing, Dan? Oops.
Good afternoon, everybody. We're going to go to the Connecticut Technical Education and Career Systems. Are you guys here? Come on up.
Good afternoon. Go right ahead. Press the button right there so it should be illuminated. right around this. There you go.
I think that may be it. Thank you.
That's much better. Thank you. Go right ahead. Mhm.
Thank you, Senator Austin, Representative Walker, Senator Berthel, Representative Nuccio, and members of the Appropriations Committee. I would like to begin by introducing myself. I am Dr. Ellen Solik, and I am honored to serve as the Interim Executive Director for the Connecticut Technical Education and Career System, hereafter referenced as CTEX. I am grateful for the opportunity to appear before you today to discuss Governor Lamont's proposed CTEX budget for fiscal year 2024 and fiscal year 2025. As many of you are aware, CTEX is in its first year as an independent agency after formally separating from the State Department of Education in July of 2022. As one of our many important initiatives, we have created and adopted a new and forward-thinking strategic operating plan for 2022 and beyond. The framework for this newly adopted strategic operating plan begins with a vision and mission that are in direct alignment with many of the governor's statewide workforce initiatives. In particular, we are passionate about preparing trade-bound students through exemplary programming and practices to meet the skilled workforce needs in Connecticut. The governor's proposed budget includes appropriations for CTEX totaling $192,225,000 for FYI 2024 and $194.9 million for FY 2025. We are very appreciative of the governor's ongoing support, as evidenced by the significant additional proposed funding to expand trade offerings and to provide additional fiscal and administrative positions. The fiscal positions are critical to ensuring that the system continues to function effectively as an independent agency. The additional funding to expand trade offerings is especially helpful during a time when education and workforce development are facing huge productivity and accountability demands throughout the state. In recognition of these challenges, CTEX remains determined to exceed the bar while remaining fiscally responsible, programmatically forward-thinking, and operationally efficient. As stated in the governor's recent economic report, some of the key areas for statewide growth are identified as transportation, housing, energy and environment, healthcare, education, and workforce development. CTEX has the unique opportunity to directly contribute to each of these key areas. For example, with regard to transportation, CTEX is pursuing significant federal green energy grant funding to expand our students' transportation options and to include the purchase and acquisition of $7.6 million of electric buses and charging stations. Consequently, our transportation students will be exposed to electric vehicle technology, and they will have opportunities to train in the installation of the requisite standard and high-speed charging stations across the agency. With regard to housing, CTEX continues to expand and improve trade offerings in the construction fields, including electrical, plumbing, manufacturing, and more, so as to meet the ever-growing demands of the state's housing market. Regarding workforce development and healthcare, CTEX is working closely with the Governor's Office of Workforce Strategy, the state's community college system, the state's Department of Education, the Department of Labor, and others to plan, develop, and implement expansion of technology and career programs for grades 9 through 12, inclusive of health technology, information technology, aviation maintenance, and more. In addition, we continue to foster impactful and enduring relationships and partnerships with significant businesses and industries across the state.
These are just some of the initiatives that demonstrate that CTEX is a significant contributor to the governor's vision for a strong and vibrant economy as we become Connecticut's primary workforce pipeline. In summary, I thank you, Senator Austin, Representative Walker, and members of the Appropriations Committee for the opportunity to testify before you today. I look forward to working with you and with the governor throughout this legislative session. And I welcome any questions you may have at this time. Thank you.
Thank you. And thank you for your testimony. This is, we have some I have some basic questions and then we have some others that want to ask. The 1,511 teacher or positions that you have in CTEC, how many of those are filled and how many of them are not?
So just to clarify, Representative Walker, in efforts to accurately answer your question, of the 4,000.3 at this point, staff members across the district, that's inclusive of full-time certified staff and instructors, as well as part-time ancillary service positions, including stipended positions, coaching positions, social and physical service positions. So there's a variety across the board. Of the full-time certified instructors, teaching and administrative positions that we have right now, we have approximately 100 vacancies. To give you an idea, that beginning of the summer, which was post-retirement period for many, many of our instructors and teachers, we at one point had a 175 person vacancy load. We now are down to approximately 100. So although that doesn't solve the entire shortage area, we certainly are facing challenges in making sure we fill all those areas. We have made quite an inroad in terms of being able to fill many, many of those positions.
So, okay, you gave me another number that I didn't have.
Okay.
I said 1,511. You said 4,000.
Correct. If you look at all of the part-time and stipended positions that are listed contractually across the number of service providers that we have, we actually do have approximately 4,000 positions, available positions. Of that, approximately 1,500 are the full-time certified staff teaching and administrative positions.
I see. Okay. Yeah, when I asked the question the second time, my colleague said, so what's this number represent? So this is our full-time staff.
Yes.
Okay. So could you bring to the work group the actual complement of all the people that are employed under the Connecticut Technical Education
Absolutely.
System?
I'd be
So
happy
that
to provide you with that information.
So the 100 vacancies, are the 100 vacancies of your certified teachers or is it throughout the system?
It would be approximately 100 vacancies, full-time certified teaching, instructional, and administrative staff across the system. Yes.
Wow.
Yeah.
Okay, that's
That's down from 175. So again, we are making progress, not as quickly as we'd like to, clearly. If it helps to know at all, at this point, the significant challenge for us in filling those full-time slots is really around our trade instructor offerings, particularly the more specialized trade instructor offerings. Those are often difficult to fill due to the availability of certain trades and those who are willing to leave the trade to come and teach at CTEX. So.
Okay. All right. That helps in understanding. I'm going to let my colleagues ask their questions and I'll come back and finish up with mine. Kathy, Senator Austin.
Thank you, Madam Chair. And so relative to the 100 positions that are in your teaching staff, one of the things that we had required the technical schools was language instruction. How many have you been able to fill any of the language instruction components of your staff?
Senator Austin, just to clarify, are you referring to the English language learning?
No.
No. Okay. So
I'm talking about the fact that we made it a requirement of technical students to also comply with some of the things in a traditional high school relative to learning another language. Different than an ELL student, we're actually trying to go the other way around and have students open up to the prospect of learning another language.
Absolutely. Yes, we have been able to fill those positions. To date, we do offer world language opportunities for students across the system.
So how many of those positions have been filled?
I don't have that number in front of me today, but I would be happy to get that for you.
That would be great. And we
Sure.
know that this is your first time sort of doing this. You've been kind of before that. I think this is actually the first time we've actually had a meeting with the technical schools as a separate entity. So we're happy about that because we think that the technical schools are extremely valuable. And so the other question that I have relative to the technical schools is I'm older, so I remember when technical schools were sort of the place you went because you didn't want to go to the traditional schools. It was like, I am playing the age. I am. I'm probably older than everybody, so. So I remember when it was like that, and then we went away from that and we made it that those who went to a technical schools were the best of those going into high school, which I think was a mistake, because I think that it should be kind of like a mixed bag in the two schools systems. Where are you relative to that? Do you require that they all are ready for college or college preparatory?
We absolutely do. In fact, Senator, we are under the same state statutes and requirements in terms of meeting academic standards for our students, as well as providing them a high quality trade and skill-based offering. So we actually ask twice in some ways what a traditional LEA asks of students in terms of performance. So we offer the 4 basic academic offerings in addition to the trade. Our students alternate between those 2 sets of offerings throughout their school month and year so that they get equal and mandated hours in on both academics and trade offering. Our standards are expected to be as high, if not higher, for academic acquisitions and skill set for our students so that they are college and career ready when they leave us. Many of these students will pursue a trade that requires more academic support. So mechatronics is a perfect example of that. Although it's manufacturing, it requires a lot of advanced and specialized information and skill set in math, that some of which they acquire when they're with us. Much more of that they may acquire at the community college or college and university level before they pursue that trade full time. So we're actually in conversation right now with the state's community college system to do a better partnership with them so that we can continue and help students continue to gain that academic skill set, which will simply enhance their ability to enter the trade. So we really want to look at more of a 9 to 14 grade level, if you will, opportunity for our students going forward in partnership with the community colleges and certainly with colleges and universities as well.
So my concern is this, is that I have students who are not interested in going to college and beyond. They may have had some dips in their educational experience in a pre-K to 8. They may not have been had gotten the best attendance, and they may have been a C-level student, whatever that may mean, because each school does that at a different grade level. And many of them would excel going into a technical school. That is right up their alley. They like working with their hands. They want to get dirty. They want to be able to fix things. They want to participate in what their father and grandfather or mother and grandmother did. So I worry that we make our technical schools unattainable by a certain subset of students that would be wonderful in a technical school, who may actually turn around and get that better job. So that's my concern. And if you could bring to the subcommittee what your plans are relative to this subset of students that is interested in getting a job instead of going to college. They may not have the wherewithal to go to college, and they may not want to go to college. So I'm worried about that component of it, and I think that Connecticut's technical schools should remember where their history is from, is those people who went to schools like the technical schools to get a good paying job. And that's with the number of people that we need at Electric Boat, with the number of people that we need at the subcontractors, 20,000 people at Electric Boat over the next decade. We're gonna use up all of those technical school kids if we can, but I worry about that. So I just wanted to make that statement. Thank you very much, Madam Chair.
Thank you.
Thank you. Next, Representative Nucci.
Thank you, Madam Chair, and welcome. So I'm really interested in the technical schools across the board. I'm older also. So, okay. I remember we had these classes in high school, right? And then we saw this development of a lot of these technical schools. When I was younger, it was Cheney, was the big one. And now we've got a few more. So I'll be honest with you, I've had constituents reach out about kids who are in the programs who are really having a lot of problems, specifically around, I have one family that I know very well. Their son is in an HVAC program and hasn't had an HVAC teacher for the last year and a half. So my question and concern around that is, how are we graduating kids that are career ready when they're in an HVAC track with no HVAC teacher for over a year? Like, I've got parents saying my kids are just watching movies. They're not being trained at all. So what are we doing around that?
So there's no question that we face a significant challenge in terms of filling some of those specialized trade positions. Representative Nucci, thank you for your question, because it is key to what we're really focused on right now at CTEX, which is to garner the staffing that we're required to garner to offer that high quality trade offering. Our substitutes, although they may not be practicing HVAC professionals, are appointed for long-term sub positions with at least a requisite background knowledge and experience in the trade, enough that they can serve as subs. Are we happy that they're there for a year? Absolutely not. Our goal is to fill those vacancies as soon as is possible. The one trade that you just mentioned, which is HVAC, is known, along with welding, plumbing, and electrical, as the lowest or least accessible instructor area. And they are also the highest retirement areas right now. So it is indeed a challenge. We are working very closely with our human resources partners at Department of Administrative Services to recruit in innovative ways a well-trained, highly skilled, diverse set of instructors in just those areas. So we are developing ways around attracting instructors through social media, through a diverse and a very inclusive hiring practices, including job fairs, both online and live. We are actually soliciting interest across the country, not just in Connecticut right now. So we really are pulling out all the stops to begin to recruit and retain high quality professionals. It's going to be a little while, because we have found that those areas are the most difficult, challenging to fill. But we want to make sure that the subs that are serving in those areas, albeit longer than we'd like, have a background and skill set adequate and more than adequate to meet the needs of providing training in lieu of a full-time, in this case, HVAC, as you said, instructor. I'm optimistic that we are going to fill those positions sooner than later, particularly with the focus right now that our Human Resources Department has on recruiting and retaining high quality instructors.
I would say that you might want to check in on that, because again, like, I've got parents who saying their kids are just watching movies. They haven't done anything with HVAC in over a year, and they graduate in a year, and they're concerned because they're not career ready. With that said, though, when you're looking for instructors, are you looking at the fact that an average HVAC guy who's been doing this for 20-something years that can teach kids is not going to have a master's in education? So is there like alternative to for these trades having teachers that are certified in the field that they're in, but not necessarily, you know, the 4-year college, 6-year college teacher degree.
Yes, absolutely.
Okay, a few of the general questions that if you can bring to the subcommittee, I would like to understand what the wait list is and what the denial rate is for kids going into these programs and the number of students that you're currently serving. I've been pretty actively telling people we need to double the amount of seats in trade schools. We need to have more trade schools out there or more seats in the trade schools that we have. Because as you mentioned, the average age of an HVAC guy is 55 years old. And there's nobody that's coming out of high school that is going to learn how to do HVAC. And you know what? We live in New England and it's going to get cold. And when it gets cold, you know who you're calling? A guy who's about ready to retire with no replacement. Same thing with electrical and plumbing. So this is a big area of focus for me, trying to find a way to expand the number of students and the amount of seats that we have. With that said, I have in your budget stuff here, there's increases for new areas of focus with 3 and then eventually 6 total head count there. Are these going to be placed? Like, I don't know how many technical schools there are. Is this one in, how is 6 people going to turn the boat on collision, criminal justice, sustainable architecture, masonry, and the healthcare track?
We actually have 18 school sites across the state, as well as 2 aerotech centers, one located in Stratford, one located at Brainerd Airport in Hartford. So we have a 20 building count at this point. We are in very focused conversations. You mentioned electric boat a minute ago, but also with some of the governmental agencies that I mentioned in my testimony. We are in focused discussions around how best to expand CTEX over time. There is potential expansion in a number of our school sites, whereby we would like to partner with health tech, as you said, electric boat and others, so that that expansion becomes meaningful to students who want to come right out and start a trade and be employed. So those conversations are taking place. Thank you also, Representative, for your question around waitlisting, because we are actually waitlisted in every single school building with the exception of one. Our admissions has increased exponentially over the last 2 years since my arrival. Certainly not because of me, I'm not inferring that, but we do see the cultural shift, if you will, away from an academic pursuit being the only option for students. And they are very interested in pursuing trades and trade possibilities. So we are waitlisted across the board. I'd be happy to give you those figures, provide those to you. I don't have them today with me, but I'd be happy to bring them.
I would love to see those. And then
Sure.
The last question that I have is in the funding for additional fiscal administrative support. I'm confused because in here it says that it's a transition from SDE to the CTEX. In the accounting world, transition means if you're looking at 22 FTE here, then I would expect to see a reduction of 22 FTE on the SDE side. And I don't think that's the case. This looks like it's new funding. So I'm wondering if you can kind of elaborate. This says provide 22 new positions and corresponding funding of 1.9 million by the end for new fiscal administrative staff. That's not a transfer to me. That's new. So what is this for?
It's actually in tandem with the State Department of Education. We currently have a memorandum of understanding with their finance department. We actually are handling all of the invoices and the sort of the preliminary fiscal needs at CTEX, and very generously, the State Department of Ed signed on with us in support of our fiscal needs through the end of June of this fiscal year. In doing that and in making the transfer, and my colleague, Mrs. Richardson, I'm going to turn this over to in just a minute so she can elaborate. But in order to process all of the fiscal requirements for 20 school sites and the vendors that are connected to those school sites, we require a significant increase in the number of fiscal staff. And I'm going to ask Mrs. Richardson to elaborate on that for a minute.
Excuse me, I'm sorry, I'm going to jump in. Could we elaborate in our subcommittee meeting, because we've got only 5 more minutes with you, and I've got a few other members who also want to ask a few questions, but I'm going to ask them to sort of bring it to the subcommittee so that we can stay on time.
Absolutely.
All right, I'm sorry. I just, yeah.
Totally fine.
We were getting in a groove, I know. No problem. Thank you, thank you. Representative McCarty?
Thank you very much, Madam Chair, and welcome to Appropriations and good luck in your position.
Thank you.
I appreciate very much the work of the Connecticut Tech Schools, and I know how really important they are to workforce development. I've been very impressed. Over at Grasso Tech, so not to dispute Senator Austin, but I see room for both cohorts. There are plenty of students, and they told me they come in and they receive and are educated toward a trade. They use the trade to go on, and they even further their education with their own funding. So there's both worlds there, but we absolutely do. And we're in that part of the state that we need the workforce development. So I just wanted to comment that you are NEAS accredited, and these are certified teachers in the system. Recently, we had a statute change, and I know my good colleague at the other end, Representative Curry, and I were involved to look to see if we would, if there was room within the tech schools for special education students. So I'd just like to give you the opportunity, if you might just speak about what type of special ed departments you have in the tech schools.
Absolutely. Thank you for your question. Representative, we have a fully staffed and very vital, actually, special education department within CTEX. We have service providers across every single one of our school sites, 20 in total. We have the advantage of garnering additional staff, support staff, including social services, physical and occupational therapists, and a number of other service providers in addition to our regular special education staff. We have supervisors who oversee the needs and the IEPs and all of the developmental processes that take place as a part of special education. Our enrollment is in line in terms of percentages with the rest of the state of Connecticut. So we get a very valued and vital special education participation rate across the district. And again, in terms of staffing, we are, my thanks to our colleagues to the left, State Department of Education, we are very fully supported in terms of our needs for special education staffing and training and all the ongoing development that occurs. So it's a very vital program for us.
And that's very good to hear. And then just quickly, will you be putting together a strategic plan going out? Because I know you've added new pathways to the tech schools, and just curious as to, because we see developing needs as we move forward, and just wondered if there will be a plan to look at what will be the next pathway. And then the final, I'm sorry if it's more than two, but
What
do you have
we're going to
any-
do is we're going to answer those in the subcommittee.
Okay, and if you could bring, how many students may be receiving the early college credit?
Absolutely.
we'll bring
Just very brief response. We do in fact have a newly crafted strategic operating plan with 4 goals that are fully aligned to the proposed work that the state is now looking at in terms of expansion for tech offerings, health offerings, IT offerings, et cetera. I'd be happy to elaborate in meetings to come on that.
Thank you. Thank you very much. Representative Curry?
Thank you, Madam Chair. It's good to see you, Dr. Solik. And first and foremost, thank you for taking up this leadership role at this time and really hopefully taking the CTEC system where I think many of us envision it can be and will be at some point. And I know you'll hear from a lot of members who want stuff done now and what are we doing now? And you know, I think you're in your infancy. And so I think we have to give a little bit of flexibility and know that it's going to take a bit of time to get to where you are, but I know you have great people behind you, and I'm specifically looking at Mr. Poulin, who I know, and I know if you have him on your team, you're good to go. But Kathy McCarty mentioned the special ed piece. I'm glad that was covered. Are you able to send us your strategic plan? Just because I know we have conversations going on with respect to the Education Committee around assessments and evaluations of where you are now, just to assure that your programming is aligned with the needs that we see outlined through the governor's office and the Office of Workforce Strategies and such. So is that all kind of part of that strategic plan right now, or will that be in the future?
So first and foremost, Representative, thank you for your kind words. Absolutely, we'd be glad to send you a copy of the strategic operating plan. The basic plan really outlines the mission, vision, and big picture goals for the agency across the board, but we can certainly enhance that information with accountability and any other offerings that you would like to know more about. We'd be happy to send you that information.
Okay. Thank you very much, Madam Chair.
Thank you. Representative Johnson?
Thank you, Madam Chair, and thank you so much, Superintendent Solik. Over here. It's good to see you. I just wanted to connect with you on, I represent a district that has Wyndham Tech in it, and we have Eastern Connecticut State University, Quinebaug Valley Community College is moving back into town. It was great, the tech schools to share its space with QVCC for a short time. And now they're going to be back in full functioning. And we really are halfway between Pratt and Whitney and Electric Boat. And I think that it would be wonderful to be able to make sure we expand and make sure those educational opportunities are there for the students and that they're working. And so I'd love to have some time with you and some time during the meetings that we have to explain, the vision that you have for Eastern Connecticut and Wyndham Tech and how we can coordinate with Quinebaug Valley Community College and perhaps Eastern Connecticut State University as well. So thank you so much for your work. Thank you, Madam Chair. Look forward to seeing you in the meeting.
Was there a question in there?
Yes, I wanted to know how they're going to plan to work together with a community college and Eastern Connecticut State University, because we have a great.
I just want to make
connection.
sure there was a question.
But thank you so much for making sure that I'm clear.
No, thank you. Are there any other questions? Anybody online? Nope. Thank you so much. We look forward to talking to you in our subcommittee hearings.
Thank you very much.
Okay. Next, we have the Connecticut State Department of Education from 1:30 to 3. So guys, bring water, Kleenex, whatever. Everybody's sneezing in here because it's freezing. There's nobody left in the building over there, huh? So there should always be all answers right in front of us. Good afternoon, Commissioner.
Good afternoon, and thank you. So Senator Austin, Representative Walker, Representative Nuccio, and members of the Appropriations Committee. My name is Charlene Russell Tucker, and I'm the Commissioner of Education for the State Department of Education. You have my written testimony. So I'd like to do is to introduce the members of my team who are here briefly, and also the information that I provided in the packet that we sent over in advance of today's hearing, if that's okay. Senator? Perfect. So the team is here. Laura Stefan, who needs no introduction. She's our Chief of Staff and Legislative Liaison. Brian Klimkowitz is our Division Director for Special Education. Irene Parisi, our Chief Academic Officer. John Frasinelli, Director of Health, Nutrition, and Family Services. Keith Norton, our Chief Strategic Planning Officer. Robin Cecere, Regional School Choice Office Director. Dr. Shawana Tucker, Chief Talent Officer. Roger Persons, Chief of Fiscal and Administrative Services, and Leah Grenier, who is our Education Staff Member Consultant in our Fiscal Office. Missing from this introduction, I'm sure all of you are aware of our Chief Financial Officer, Kathy Dempsey, and certainly our thoughts are with Kathy and her family at this point in time. So in your packet, we gave you 8 documents as we were anticipating some of the things that you may have questions on. There's the 11 ways that we're leading educator recruitment and diversification efforts. The 17 ways that we're supporting multilingual learners. The Alliance District designations for 22-23 through 26-27, and kind of how we do that calculation in the districts that are so designated. A report from the Center for Connecticut Education Research Collaborative, or the executive summary on the LEAP program, which is the Learner Engagement and Attendance Program, not to be confused with the LEAP program that is in New Haven. But again, there's $7 million budgeted in the governor's budget, so we wanted to share that report with you. Also in the packet, a press release that we've done in McKinney-Vento. We have a No Matter What campaign, really working to support our students experiencing homelessness. There's the ESSER investment one pager that shares kind of where we are in districts drawing down those resources. And also attached to that is kind of the cheat sheet for how you can go online. Every plan that's approved is online, and that information is provided. We gave you some information on dual credit expansion project that's underway and a charter school process one pager. So with that, I am here with the team and we're happy to answer the questions that you have.
Thank you, and thank you for bringing your team and hoping that we can get some answers and then some for the continuation in our subcommittees. So I've been asking every person possible today about their staffing. So in the budget book right now, we have approximately 275 listed. How many of those positions are filled and where are we with filling the completion, or do we have some more expansions?
So thank you very much, Representative Walker. And you're exactly right, 275 authorized. Our funding, however, will support about 175 staff in the agency, and state funded positions currently in the agency full-time is 101 with 16 temporary workers, so about 116 staff members. We do have, not accounted for here in those numbers, our staff members supported solely by federal funds to support federal projects and our federal initiatives. But the information I'm giving you is around the state funded positions that we have.
So when you say that you have federal funding, could you bring to the subcommittee the staffing you have and where they're funded so that we know exactly, like if they're federal funding for, I don't know.
Title I or.
Yeah, Title I or the homeless, the McKinney-Vento or something like that.
Sure.
We could get the listings and how many you have. So you have 175, so you're down at least 100 staff members.
Between what we can fund and the authorized count.
Okay, so yeah, so tell me that again. So you've got funding for 275, but you've got an authorization.
No, so we don't have funding for 275. We have an authorized count of 275, but based on the funding that we have to support that, we could only support about 175 of that 275.
Is there a discussion to complete the numbers so that we could get a more robust staff count in State Department of Ed?
Great question. And we currently have these conversations back and forth, of course, about where we are. And you also asked, Representative, about kind of where we are in the process. Active recruitment, meaning positions posted, closed, going through interview process, all of that. I now have 41 positions in that queue, right? That is really, we're really thrilled to be able to move those through the process, but those are active recruitments that are going on right now at different levels.
So you represent a sizable part of the budget financially, I mean fiscally, because of all the funding that you have for ECS, et cetera. I mean, you have over a $3 billion budget that is there. I guess for me, I'm concerned about the fact that you don't have a larger complemented staff to that, because you have all of our formulas that we use and change and change and change for educating our children in the state of Connecticut. So that's very concerning to me, and I'm sure to many of my colleagues, because we rely on that information that we can get from you at all times. I know you're doing the best, but when you're down 100 people, that doesn't need to be said anymore. So, okay, I'll leave it alone for now. But I will say I'm extremely upset about the fact that you don't have more staff, because we do have so many people that are really focused on education. And when we hear issues about the chronic absenteeism and then our reading and math levels in our districts, it's important that we have the ability to get the information, which you guys do provide us as soon as possible, but I think we would have more security with having more people helping you all compile all of that information. So I'm going to ask just a couple of in the document that we received from the governor, he has gone back to capping funding for different programs. I know we put a pause on adult education for a while, but then it's back in the book. In those formulas, by capping the funding from the state, that reduces the access to providing funding for those students in that area. Isn't that correct?
That is correct. And I'm going to ask Leah Grenier to could join me here just to talk about, she's dug into the budget for us in Kathy's absence, to talk a little bit more if you have specific questions on those, on the funding formulas and the caps that are there, Representative.
Thank you. So Leah, when you speak, push that red button, so the button, so the red, and then just give us your name. But in those three different items, excess costs, human health and welfare services, and adult education, is there a specific formula for each one, or are they each one separately or individual?
Hi, yes, my name is Leah Grenier. I work with
Speak a little louder.
Hi, Leah Grenier. I work with Kathy Dempsey and Roger Person in the fiscal office.
Okay.
The formulas are different for each one. Kevin Chambers in our office is the one that calculates those, but should funding be over what the appropriation is, they're prorated down to whatever level is budgeted.
When we come to the subcommittee, could you, hearing our discussion, whatever we call it, could you bring those formulas to that so that and we'd like to know, when did we start those formulas of capping? I think they go back about 20 years, but I just want to show the fact that capping is not something that's necessarily a good thing for these programs. They're very important. So I'd like to see that in the discussion. Okay, thank you. All right, first is, let's see, what's that say, Kathy Austin? I don't know what my last name is. I always say Kathy. Yeah, Senator Austin. Okay.
Thank you. Thank you, Madam Chair. So I'm looking at, again, I want to go to the formulas that Tony was talking about, Representative Walker was talking about, and that's excess cost. Can you tell me what level that covers excess costs now? What would be the level that would now be covered if we went with the governor's policy for excess cost?
I am not sure the percentage. I didn't calculate that, but full funding is in the budget as about 180 million, 182 million in the second year of the biennium. And
so it's full funding at 100% of the students that you know today to be special ed or covered by excess cost would be 180 million. Correct. For us to have full funding. Thank you for that. And I have a question. We've been we as legislators are invited to every CABE, CAPS, REST, magnet schools, charter schools, go to community colleges. We spend a lot of time going to school things. And one of the things that is going on is we've been asked by the rest that handles magnet schools relative to the chef settlement, saying that we're not giving them enough money and that they aren't anywhere near where they should be. Can somebody get me the numbers relative to the number of Hartford students that are now going to magnet schools and the number of Hartford students that are in Hartford, so that we can see, I think we spend a lot of time moving kids around. And I'm not certain that, quite frankly, I didn't want to vote for the chef settlement. Everybody said, oh, it's the best thing since sliced bread. Please support it. And so we did. I know you did it. I know you did. I know exactly how you feel about the chef settlement. But it doesn't seem to me to be making any sense because we were told that that was going to take care of the funding needs, that plan that was rolled out in the chef settlement. And that doesn't appear to be what the people running the schools are saying. They say they need more, but I'd like to understand how many Hartford children are now going to a magnet school outside of the city of Hartford, and how many students are being taught within the confines of the city of Hartford.
So thank you, Senator Austin, and we will certainly provide information for you when we get back. But I'll also, Robin Cicero, who is the Director of Choice, just want to bring her here for a minute, but to also let you know that the department also in our EdSite data portal developed a choice dashboard that allows you to now go and see, and Robin will correct me here, but that you can now go and isolate students for like the example that you mentioned. You can see the numbers of students, you can see their performance level. So we literally created in full transparency, so you're able to see information for choice programs on our data portal.
To be fair, I love charter schools. I think the magnet schools are doing great work because it seems to me that many kids that were in traditional schools were not being as successful as they appear to be in the Stanford School of Excellence is one of the best schools, disregarding the fact that it's also a charter school. The governor invited Integrated Day Charter School up because they'd done such a great job getting kids back on track after the pandemic. So I'm not saying that. What I'm trying to figure out is in particular this chef settlement, because I don't understand. It seems to me that we never can give enough money there, to the detriment of some of the small rural communities who we are going to see decimated over the next little bit of time. So I'm worried about that. So go ahead.
Good afternoon.
And who are you?
Oh, I'm sorry. I'm Robin Cicero. I'm the Director of School Choice. So the commissioner is correct. In EdSite, we now have a resident town portal, so you can look at dashboards, so you can look exactly by town participation by students from that resident town and see the different demographics of the students as well as achievement. So that does provide a lot of information relative to the magnet schools and other choice programs. To answer your question, there's about 9,800 Hartford resident students in magnet schools in the greater Hartford region and about an equal number in neighborhood schools. So it's about 50% participation at this point. Relative to the funding, the chef settlement agreement didn't address the per pupil at all. What it did was provide supplemental supports that would enhance the magnet schools as well as the open choice opportunities. So open choice, there was an additional 2,000 per pupil added to the tiered attendance grants, but relative to magnet schools, what we did was provide supports for things like extracurricular programming, athletic programming, and then reformulation to support schools that had some funding challenges over the last few years, certainly around enrollment in particular, to provide those fiscal supports so that they could reformulate their programming and enhance in terms of attracting students in an interdistrict environment.
So it's 9,800 and 9,800.
About that, give or take. Yeah.
Give or take.
Mhm.
My last two questions are to bring information to the committee, Can you bring to the committee where you stand on all of the curriculums relative to the like the Native American curriculum? Where are we? What schools have accepted them? How are we rolling that out? If you could bring that would be helpful. And Tony made me forget my second question.
You'll come back.
I'll come back to that. Thank you. Thank you, Madam Chair.
Thank you.
Thank you.
Thank you. Senator McCrory.
Thank you, Madam. Thank you, Madam Chair. I guess it's a question, but a comment, but it's really gonna be for our working session. I noticed one of the things that you talked about often is diversifying our teaching workforce, and that's something that you guys are looking to work on, and that's something that I am working on in the Education Committee. And I noticed that in the governor's budget, he is allocating $2 million American Rescue money for that. Well, I'll suggest this, when we come to the working group, let's work at a real number, because we can't do this. This work takes more than a one-time shot. This is gonna have to take continuous efforts year after year after year, because we did nothing for the last 40 years. So this is gonna have to take a serious financial commitment to actually recruiting, retaining, and developing our own students and developing a diverse teaching population. So I suggest when we have this working group, we're gonna have to come up with a real number that's gonna really work and do the work that we want to see on that side. The other part was in regards to, I just heard a conversation about choice program, and I said this privately. I'm concerned about the 25% cut in the open choice program, considering the student population in Connecticut is decreasing, but the option for parents in open choice and charter and other programs are increasing. The fact that these children are gonna be leaving their communities and going to other communities, they're gonna need a great deal of support in school and around school. So having a 25% cut in the program where parents are choosing to place their kids, I'm concerned about that. So we'll have to have a deeper conversation when we're in our working groups. Thank you.
Thank you, Senator.
Thank you. Next, Kathleen McCarty, Representative McCarty. Sorry.
Thank you very much, Madam Chair, and welcome, Commissioner. And
Thank
thank you
you.
first, before I forget, it's not a question. Thank you for this packet. It's filled with a lot of good information. I really appreciate receiving it. Thank you so much. But it brings me to the question of the LEAP program, looking at attendance and trying to bolster the attendance rates. And I noticed in the budget, so if you could bring to the working group really how you subdivided that and where those funds are going in each one of the categories in the LEAP program and where you see the success. I think we need to make an argument, honestly, that these funds are well used for that purpose. It's nothing more important than having our students back in school. And I hate to see it zeroed out if you're in the middle of trying to do this work to bring the students back. So maybe if you could give us some figures and look at how many and what the success of the program has been and what you think the vision should be going forward for the following year where it's zeroed out. And then I tie that also to credit recovery. As you know, I did put something in that regard because I know in a lot of the districts, if you have an attendance issue, you're also losing credits. So if you could perhaps let us know where and how we can be of help to with the department on finding ways, creative ways to bring the students back in and then help those that maybe perhaps in some of the after school program. I'll let you speak to that, but that's an area that I really find a very primary focus that we need to do some work on. So if you wouldn't mind to bring that information back, that would be very helpful. And then just also how many, perhaps statewide, how many students are really using the ECE? I know in our district, we've had students that have really gained over a semester of credit for early college. So it'd be good to just see where we are in the state. If you can bring that information to the working group too. How many, I know it's a lot, but if we could just see that the program is working to its maximum. Okay.
So thank you, will do. And in your packet, Representative, that you received, one of them is the evaluation of the effectiveness of the home visits done by the LEAP program, over 20,000 visits done across the state. Those are folks knocking on doors, connecting with students and families. So in that, we have an executive summary of that report, but we gladly share with you, this is something that is working very well, that our state is doing, that has been nationally recognized. And more than that, we're getting kids back into the classroom, which is really so important. So it's impact. So we can share more information with you, but when you have a moment, you can scan through. There are 15 districts participating in that program, and we were able to share in that executive summary, evaluated by a group of evaluators from our private and public universities about the impact of that program, and we wanted you to have that.
And I know it's a great program, excuse me, this is just very quick, that, but it's in certain areas, and that's why I'm looking for the success rates. Because I think that going forward, it's zeroed out, and we want to be sure that we can continue the program.
Perfect.
Thank you.
Thank you.
I remembered my question and she's taking her time talking to somebody. Can you figure, we had the state library here earlier. And there was a conversation with Representative Porter and the state librarian, who talked about the fact that many of our schools are not funding their libraries anymore. Is there any way that you can let us know how many schools have libraries that are not funded by the Board of Education? Because I can tell you in Sprague, it's funded by the public library. It's not funded by the Board of Education. So if we could, is there any way that you could get that number for us or try to get that number for us?
We can try to do that. I'm not sure it's one of our data collection pieces that we readily have, but we will certainly make every effort to see what we can have for the
Thank you,
working
because
session.
Representative Porter, I think she said 4 of their schools don't have libraries operating. 5, no, how many? 10. She said 10 of their schools don't have operating libraries now. And so I think that that's a interesting factoid for us to understand when we increase the amount of money that we're putting in every year. So thank you. Thank you, Madam Chair.
You gotta love New Haven. Representative Nuccio, followed by Representative Curry, followed by Representative Exum, followed by Representative Paris. That cover everybody? And Representative Johnson. Go ahead.
Thank you very much. Thank you and welcome.
Sure, thank you.
I know, like, I have a lot of questions on this, so I'm gonna be sending some to the work group. Did you see how fast that look came? Like, see? I'm getting it. So the first question I have is a fairly simple question. Regarding the chef transportation contract. This is a pretty big increase. I'm wondering if you could tell me what's driving the increase and what specifically this is.
Thank you.
Oh, sorry. The new contract is a 5-year contract that we implemented for the first time in a long time to have a longer term contract. That contract reflects changes in terms of the costs relative to vendors. Those costs have gone up significantly, as well as the amount of students we transport. So that includes that 5-year contract plus those additional costs that came from the negotiations with vendors and the issues relative to both fuel and bus driver shortages.
So I guess to dig into that, I'm trying to understand in the towns, right? I know a lot of kids that go to charters and magnets, there's no transportation for them. So the town has to pay for so what is this? What is this state that's $20 million?
So the chef transportation is a little different. So in the chef region, if there is a school within the district, then the district does transport students in district. If the student goes outside of the district, so they're going to a school that's outside of their town, we provide the transportation. So that's all included in what you see in that transportation contract. Typically, that chef transportation line item was not reflective of the actual cost of transportation. We would use the magnet account to support those additional transportation costs, but we've moved to be reflective of the actual cost of that transportation, which is across about 40 towns. So it's a very significant transportation zone. We transport about 14,000 students. Outside of the chef region, the districts do transport the students. They do get a per pupil for that transportation of $1,300 per pupil. Again, if the school is within the town, that town transports those students as well.
So if they're out of district, so if I look at my towns, like if I've got kids in Tallinn that are going to Magnets in Hartford and the parents are driving them because there's no transportation, how is that accounted for? Is this just the kids that are in the chef towns? This is the transportation to provide to get them from Hartford or wherever to all these other towns?
Exactly. So in that chef region, it includes both open choice, so taking Hartford students and transporting them to surrounding neighborhood suburban districts, and then also to Magnet. So all within those 40-town region, transporting any student who participates in a magnet school, whether that's transporting to Hartford or transporting to one of the other towns in which the chef magnets exist.
Okay, so for the open choice kids, then, I guess my question is, how are we optimizing this? Are you using a large bus to transport 14 kids to like a town like Tolland or Ellington or Summers?
Yeah, absolutely. So what we do, first of all, with regard to open choice, we break the Hartford region into the Hartford City into 4 zones based upon residential zone. And then we align that with certain districts so that it has those transportation efficiencies, plus it's easier on the family. We want to shorten that distance between the home and then the school. So that's the open choice. Relative to the magnet system, we don't restrict students' opportunities in terms of what magnets they go to, but we do use centralized stops. So to have those efficiencies, otherwise it would be, cost prohibitive to get students to those magnets.
Okay, and I'm gonna use my last question, allowable right now, for the file that you guys sent out regarding the ECS budget adjustments compared to the current law. It looks like the numbers are different here than they are in the budget book. So I'm trying to understand the difference in what's driving that between the numbers in this workbook in comparison to what was in the budget and then the drivers behind those changes. And by the way, I have worked with Kevin in the past. He's awesome.
Thank you. So we have Leah to try to explain that.
I'm sorry, I'm not sure exactly what you're referring to as far as a worksheet and what's in the budget, but
The ECRS summary of the budget adjustments compared to current law. I think there's change in the ECS formula, the dollars driven by the formula compared to what's in this budget.
Representative, can we do that in the subcommittee? Because that's a long explanation. Can we do that?
Yeah,
Okay.
yeah, I just, I'm gonna wanna understand like what's
Yeah.
driving the change there.
Yeah.
And then lastly, have you guys calculated what 5003 would do to the ECS?
The legislation,
Yes.
I don't think we.
Say that again. I'm sorry.
Have they calculated what 5003
Uh-huh.
HB would do to the ECS?
They would not do, we can do that in our meetings, but that's a bill, and this is just about the governor's budget. This is not about the different, because there's so many bills and policies, they couldn't keep up with all of them.
Okay,
Okay,
all right, thank you.
thanks. Thank you.
Thank you.
Next, we have Jeff Curry, followed by Antonio, followed by Tammy, followed Representative Ixom, followed by Representative Harris.
Thank you, Madam Chair. Commissioner, always nice to see you. And
Same here.
thank you and to your team for all of the hard work that you all do. Again, given the constraints that you are under with your staffing levels. So staffing, something that we have talked about, and it's not going to be ad nauseum because it's important to talk about. Do you need 275 or do you need 175 in order to do everything that you are charged to do and that we ask you to do?
Great question, Representative. And as you know, we do have, from where I am sitting, right, as the Commissioner of Education, when we talk about education, I always need as much as I can get. However, we recognize the budget constraints, and we also recognize the constraints that you all have when you look across the state and all the state agencies. So we'll continue to have those conversations about the needs of the agency that we have and the capacity that we need, especially when we have legislation adding to the work of the agency.
And the 41 that you said that you currently have in queue, can you bring to the work group where exactly in the queue they are and when you expect them to actually be hired and within the agency themselves? Also, if you could also bring to the work group, so ECS increases typically run $35 to $40 million a year. We see $45 million here in each of the next 2 years and then some. Could you provide the information as to the additional need, as I assume that's based or that it is based on the fact that we have rising need and we have the weights within the ECS formula, which is also based on enrollment. We see many people out there with graphs talking about certain increases in costs, but when you have a formula that is based on enrollment, it's usually the need that drives those costs. So if you could just kind of break that down for us at the work group, that would be great. And then I will just dovetail off of what Senator McCrory was saying. All of the investments that we see here using ARPA funding are fantastic. I think we all know, sitting in this room and outside of this building, that those are going to need funding well beyond the term in which that money is permitted to be used. And so we hope we're cognizant of that and that we have a commitment from the administration moving forward that they're going to continue to provide that funding to support those additional programs. But again, thank you all for the work that you're doing. Thank you.
Thank you, Representative.
Thank you. And I'll get you one of those 8 balls and we can find out when we're going to get the 41. Okay.
I keep that at my desk in the chamber, actually.
Well, we'll bring it over to the meeting. Next, Representative Representative Felipe. It's a long day.
Yes, thank you, Madam Chair, and thank you, Madam Commissioner, for bringing your staff. Happy to see you for the second time in 24 hours. I wanted to just echo, first of all, the sentiments of my Madam Chair and Representative Curry before me, just about the staffing levels. I think it's super important that we make sure we are giving you the opportunity and the tools to do the work we need you to do. Over the last couple of years, we've had things like African American Studies, AAPI, right? The Native American history. And this year we're doing the English Language Learners Bill of Rights. And part of that, we're hoping to have recourse in there. And that would obviously put a little bit of, onus on you and your staff to step in some capacity. So just wanted to make sure that we on the subcommittee level are just making sure we're looking at what staffing looks like, how we can make sure it works. And, this is one of those places where we're really willing to put our money where our mouth is. So somebody should let us. But when it comes to LEAP, I just wanted to ask that all the things we asked for yesterday on the Education Committee also be sent to the subcommittee along with the things Representative McCarty asked for earlier, just to figure out where the money is going, but also the impact that it's having. Just want to make sure the committee had that. And thank you, Madam Chair.
Thank you, Representative.
Thank you very much. Up next is Representative Exum, followed by Representative Paris.
Thank you, Madam Chair. Good afternoon. Good to see you, Commissioner. and good to
Same
see
here,
everyone.
Representative.
I just have a question on one item here because I'm frequently thinking still about children's mental health. And I see there's a line item around primary mental health. And I just wanted to know what that reflects.
So that's a program, and I'll have John Fresnelli join us. That has been on the books for quite some time. It's a primary mental health program that's run out of his area of work. And we will share with you a little bit about the program.
Sure, thank you. John Fresnelli, Division Director in School Health, Nutrition, and Family Services. So the primary mental health program is a preschool program. The funding goes out to about 20 different districts, and what they provide is a space for a school psychologist to work directly with early childhood children, sort of getting them ready to join kindergarten, being kindergarten ready. And it does a lot of things, not just academics and supports, but also, to your point, mental health and supportive behavioral health for those students.
And getting them prepared to enter into elementary school as a
Exactly.
kindergartner.
Yep,
Okay,
exactly.
all right. Thank you so much. And I look forward to reading up on the home visits because I know that isn't exactly tied into everything we were looking to do, but that truancy component is really important. So I look forward to reading this report. And then I just want to know, I know this isn't the space for this, but I would like to know an update when we have the subcommittee meeting on what is going on regarding some of the school-based programs, the surveys, maybe, looking at some of the pieces we outlined last year in 5001 around children's mental health. And I know we had quite a few requests to the schools and that level of engagement, but I would like to know if there's anything that could be provided as an update at that time. I'd appreciate it.
And we will add to that the status of the grants, because I know
Yes,
that was
yes,
something that you were interested in as well.
Absolutely. And there was a survey, the mental health grants, those pieces would be great.
Yeah.
Thank you so much.
Thank you.
Thank you, Madam Chair.
Thank you, Representative. Representative Paris.
Thank you, Madam Chair. Commissioner, how are you?
Well, thank you.
Doing well. I have two quick questions. The first around the No Matter What campaign. So I was obviously, like so many others, disappointed by the exclusion of funding in the proposal budget to tackle homelessness of any kind across the state of Connecticut. But I am, however, encouraged by the No Matter What campaign being able to provide some kind of resources to our students across the state. My first question around this is how many families so far have self-reported the need for these resources throughout the state?
Go ahead.
So with regard to self-reported, I can tell you that the number of students identified as being homeless and under the McKinney-Vento Act, homeless includes not just what we call true homeless, so but also includes families living in shelters, families. The majority of homeless students of the students in Connecticut are what we call couch surfing or doubling up with family because they've lost housing. So out of the total number that we have now in this school year is about 4,004 students that includes. And so about 67% of those are doubled up. They're living with family, they're living with relatives, or they're staying on friends' couches and things like that.
And I'll just add,
ahead.
Representative, that when we disaggregate our data around student attendance for students experiencing homelessness, it's maybe triple. And so that's why at the agency, we recognize that there is a need to have this campaign about identifying the students and providing supports as well. We were really pleased to have gotten the federal resources, which is what we're utilizing for the campaign and supporting more districts than we normally would be able to do that. But it really is important that there's a social media campaign for students themselves to be able to even self-advocate for themselves and resources. This is really important for us as we think about the numbers that John mentioned of our students experiencing homelessness and how they're doing in school. So hence the No Matter What campaign that we're facilitating and funding through the federal COVID relief dollars, McKinney-Vento dollars.
And I'm obviously quite grateful for those dollars to be put to use here. I think my concern then thus becomes is what happens when those dollars run out, because the issue of homelessness is never going to go away. But any additional data that you can, first of all, 4,000 students is just astounding, but any additional data that you all can provide to the committee, I would greatly appreciate it on this effort. And that leading into the second question, any additional data that you can also provide around the minority teacher recruitment effort would be helpful. We don't need to go into it here. Thank you, Madam Chair.
Thank you very much.
Thank you very much. So Commissioner, in the handout that you sent to us relative to charter schools and the ESSER funds were in that handout. It says that you received 7 applications on December 1 for new charter schools. Do you have a list of those? Can you bring that list of those charter schools to the work group? And does that include the 2 that have not been funded that have had previous applications in?
No, these are 7 new ones.
How many do we have that are outstanding that have not made it through all the way through funding?
So there are 2 of them that have the initial certificate of approval from the State Board of Education that have not been funded.
Norwalk and Danbury.
And Danbury, that's right. But the new ones we're talking about are actually new
So
applications.
401 of the people that are coming tonight are about Danbury. Just so you know, 401.
Up
Uh,
500.
So I just wanted to say, that, and I have 2, if you could bring, the American School for the Deaf has let us know that this funding is inadequate for them. Have you talked to the American School for the Deaf?
No, I haven't.
I don't know if that's something that you would normally do, or if it just comes through funding through us and just kind of gets tacked onto your budget. So do you ever talk with them?
I know our chief financial officer, Kathy Dempsey, has had conversations with the American School for the Deaf. So we'll follow up.
All right, and if you could bring any information that you get relative to what they need to the working group, that would be wonderful. And family resource centers, also another area where we're seeing, they're saying they have an increased need, and that really has not increased at all in a number of years. If you could bring to us a plan on whether you believe that that's enough funding for them or that is not enough funding.
Thank you. So the Family Resource Centers, in addition to each of the Family Resource Centers get about $104,000 a year. We actually, the Commissioner appropriated an additional $10,000 to $20,000 from the American Rescue Plan ESSER funds, the state education funds, last year to continue to support the 58 existing Family Resource Centers.
So there's 58
Currently,
Thank you.
currently 58.
And so, so last year they got $10,000 or $20,000, depending on the size of the Family Resource Center, I'm assuming?
Per family resource center, depending on how many they had in their district, yes.
Okay. And so if, well, obviously they're not gonna get that from ARPA this year. So is it time that we consider increasing that line item? Is that something that we should be looking at relative to the work they do? I think the work they do is valuable.
Certainly do valuable work, and we can certainly bring some information back to you about what we're learning about the additional, what they were able to support with the additional resources that they have.
Okay.
Yeah.
Thank you. That would be helpful. Thank you. Are there any other questions? Representative Johnson.
Thank you so much, Madam Chair, and thank you, Commissioner, for your work. And one of the things that I'm trying to look at when we take a look at the schools that have been underfunded since Weicker was the governor, and now we're working on making sure that they're being equalized with some of the other schools that were in some circumstances overfunded. And we're doing that equalization, and in this proposal this year, it's to try and have it accomplished by 2025. But there's also the other things that occurred, like the special education programs that in the underfunded districts were perhaps taking away from access to educational opportunities for the students that are not special needs. And so we have a real problem in terms of say staffing requirements. In some of the districts, you may have a classroom the size on average 15 students, whereas in the underfunded places, the classroom sizes are around 25 to 30 students. It makes a big disparity. And then to take into consideration the other aspects of the things that are wonderful that you're doing with a proposal for students that have a home language that isn't English, and trying to address those with new techniques that I'm concerned that we have yet to develop a really good way of addressing students that have a home language other than English. These things, to put them all together, how will we rebalance that, making everything more equal when you take into consideration the legacy of underfunding, the necessary requirements under federal and state law, that special education occurs in a particular way and is not fully funded by the state of Connecticut, with oftentimes surprise additional costs going to the town. How are we balancing all those things? And I guess I'm looking for an overall statement of what the policy might be to balance that, just so that we have the idea of the underfunding, the fact that in many of the underfunded places, we have homeless students, which was Representative Harris was just talking about, all of these different things coming together. I can't think that we might want to see an immediate response from some of these districts that have been classically ignored by the state. So I just wondered, is there an overall picture that we could look at in terms of the plan to address these underfunding circumstances in these places where the economic determinants of the people as well have been classically ignored? So whatever you can do to help us out with that analysis, that would be great.
So thank you, Representative. And I think a big part of it is really getting a good sense of what are all the resources that are going into a particular district. I know we did that with one district before, looking at all the state funding, all the federal grants, all those that's available. I think that's a starting place for the district to see where they are and to start having those conversations with them. I think that would be the best approach, is to see what is, as we then work through, then what do you need? We've been able to take a look at our resources, even some of the COVID resources, to determine, especially some of our smaller districts that may not have gotten as much as others have, to see what we could do with some of our state set aside funds to support them. But it really does start with looking at kind of all the funding pieces that have come together in a particular district and start the conversation there.
Thank you so much for your attention to that. I really appreciate it. Thank you so much, Madam Chair.
Thank you.
Thank you. Next we have Representative Chalesky. Sorry.
Thank you, Madam Chair. I know we talked at length about choice schools already. I'm new to the legislature, so I'm still confused by this magnet school line, where your agency requested an increase, and the governor suggested a substantial decrease the first fiscal year, and then a substantial increase the following fiscal year, to the tune of $10.4 million. So is there anything you can, any further details you can provide to us, other than what we received in the budget worksheets?
Thank you, Representative. Oh, I'm sorry. The changes in that choice account reflect the actual data that we got from enrollment. So we typically obviously base our enrollments on what the operators project. Prior to most recent legislation, those enrollments were subject to a fiscal cap. That wasn't continued as of last year. So it sort of changed the dynamic around enrollments. And so we really looked at what the projections were relative to actual. So that number did come down internally based upon a better reflection of what actual enrollments look like. So those were the adjustments and the reduction to the choice account. We did see some shifting around as well in terms of just where the money was. So we had a shift from open choice dollars into a non-chef transportation account, which typically sat in the open choice account. So both the open choice and the magnet, that's just a reflection of what it really looks like relative to enrollment. Without those fiscal caps, we'll see those magnets phase in, increase enrollment, hopefully to capacity, but that's going to take some time. So the next biennium, we took it down a little bit to reflect that, and I think it will build over time. It does preserve the chef settlement piece, of course. So those enrollments will increase, and that's maintained, and so that's an increase, whereas some of the enrollments outside of the region reflect a decrease.
Thank you very much. Thank you, Madam Chair.
Thank you. Before I go on, I'm on the ECS formula that we're going to talk about in subcommittee. We noticed that we were told that the numbers that the governor had for current services are different now. So with the October 1 census, that the number went up from 45 million to 47 million and from 90 million to 94 million. So when we talk about, if we talk about what the numbers they use and what these numbers are that we have before us, because I think everybody needs to know the dates that change, what our deadline numbers, dates are for us to get the numbers for us to calculate these formulas. And I think that's really critical so that we can all have it very clearly marked on our sheets for cost sharing, for all of them, for magnet, etc. Representative McCarty.
Thank you very much, Madam Chair and Commissioner. I noticed when I'm looking through the budget, there are a lot of different areas that are directed to parental engagement, and I want to commend the office for all the work that is being done. Would you be able to just bring more information on the trust fund? I believe it's called the Parent Trust Fund. Those are grants, I believe, for more training for safety and healthy of our students. So that would be interesting, I think, to bring that. And then the EdSite portal, what you do to engage parents there, just giving the opportunity to the department to show all the work that's going on with parental engagement in a positive light. Thank you.
Perfect, will do. Thank you, Representative.
Thank you. Senator Austin.
Thank you, Madam Chair. And when we're looking at the school breakfast program, line item of $2 million, what does that fund?
The $2 million, and John will correct me on this, is a share that we have to, that the federal government requires us to put in into the program. It's a match that's required in the federal law. Yes.
Actually, Commissioner, forgive me, the school breakfast funding provides $3,000 per school in Connecticut that participates in the federal school breakfast program. The legislature saw to it several years ago to provide $3,000 per school for participating in the federal program as an incentive to participating in the federal program
$3,000 per school, not per student, per school.
per school.
Per school. And that $3,000, how many schools is that CEP?
That's not CEP. So the number of schools that participate is about 900 out of the 1,200 or so schools in Connecticut.
So 900 participate in
The federal school breakfast program.
the federal school breakfast program, which is different than CEP.
Correct.
And what is the difference between the federal school breakfast program and CEP?
So CEP, the community eligibility provision, is a provision in which school districts with at least 40% of their students are eligible for free meals can opt in to the community eligibility provision. And then they're required to serve school lunch and school breakfast for free to all of their students. So there's a multiplier that the federal government applies in order to give them additional funding. And so in cases where a district is at, the magic number is 62.5%. So if 62.5% of their students are eligible for free meals, the government applies a multiplier of 1.6, and that equals 100%. So the federal government provides reimbursement to the district at the free rate, the highest meals rate. But if you're below that, if you're at 40%, then the district still has to provide free meals, both lunch and breakfast, to all students, but they don't get reimbursed for all of those meals at the high rate. Whatever that percentage is off the top of my head, it's about 70%. So 30% of those meals are reimbursed from the federal government at the paid rate, which is about 40 cents per meal. And the district has to come up with the rest of it in order to cover that.
And the free breakfast program is if a school like Norwich, for example, receives free breakfast and lunch for all their students. They're at a high rate of student need, and they get to get that. Do they still get $3,000?
Yes.
So that is just a flat amount that we decided would do something to cover the admin costs.
Yeah, it was initially intended as an incentive, but it does provide additional opportunities for breakfast. So there are several ways to provide breakfast, and depending on the school, some work better than others. So the $3,000 are in some cases provide breakfast carts, so they can have grab and go breakfast in the hallway for high schools, so they don't have to sit in the cafeteria and things like that. So those kinds of incentives to facilitate the provision of breakfast during school hours in creative ways.
So that was a while ago where we were trying to get breakfast served in schools, and that was one of the incentives that the legislature had put in for schools to participate.
Was the thinking, did it have something to do with absenteeism and encouraging kids to come to school to get food?
We do know that breakfast pays dividends. Both it encourages kids to come to school and come to school on time when breakfast is served, and it does. The research is very clear that even students who have breakfast at home before they come to school, if they have breakfast at school, they do better on standardized tests. They do better on complicated math tests. So it does pay dividends, and it does encourage again families to get their students there on time.
And the funding that's relative to the Connecticut Writing Project, why was that eliminated this year?
It was because the ARPA dollars became available for the next 2 years to cover those funds.
Yeah, so that if that should happen, then we lose the line item and then it doesn't show up again. So
We'll put it in and put it out and put it in back in.
we'll put it back in again and we'll just try to,
Keep the writing focus.
yeah, thank you. And Commissioners Network lost a little bit of money. How
Yeah.
many schools does the Commissioners Network help out?
So I'll have Irene Parisi on that. I believe the
And
reductions
Irene
were
is the
more.
one that's doing all the curriculum, isn't she?
Yes, it's all happening in the academic office, and the turnaround office, Commissioners Network School, Charter School is all in that space as well that she oversees. And so I know that there were some efficiencies that were gained as to why those numbers got adjusted, but she's counting how many schools that we have in the Commissioners Network School.
So when we have an efficiency, we make a reduction in their budget. That's a good incentive. Okay, just
I'll
saying.
let you explain that.
Representative Walker. Hi, Irene. How are you?
Hello, nice to see you.
Nice
No,
to
that's
see
okay.
you too.
So, Irene Parisi, Chief Academic Officer for the
You
department.
have to talk up because
We gotta.
we're old. Some of us are old. I know I am, hearing.
Understood. Thank you. So Irene Parisi, the Chief Academic Officer for the department. We currently have 18 Commissioner Network schools. Some are in the planning phase. So they go through the first year initially creating the plan with a lot of support. And then ultimately the process is that we then move forward with a recommendation for them to be part of the Commissioner Network School Program. We also have schools that are in their last year. So there's a number of years that they're in. 3 is generally it, but sometimes we recommend for a 4th or 5th year based on the work that they're doing.
Thank you for that. And if you could let us know which schools are currently working through that would, at the work group, that would be very helpful. We have a school system in Groton that has a number of students that are military children of military men and women, and the changes around the Groton number of students dramatically year after year. One year they have a lot of students, one year they have less students relative to the deployment of their particular family members who might end up going to a different place year after year. We've heard, I'm speaking for Representative Connolly, is increasingly concerned that the ECS funding is changing dramatically relative to the fact that when the numbers are taken, they don't reflect the numbers of children that come in. So is there any way, have you looked at the funding for Groton relative to the military children that are there?
We'll take a look at it. I don't think we've done that, but we
But-
will.
It's something that I think that we should pay attention to. Thank you. Thank you, Madam Chair.
Thank you. She went through all the budget. Are there any other questions? Representative Exum.
I just have one follow-up question, just based on one of the things that Senator Austin asked. Around the federal school breakfast program, you said 900 of the 1,200 schools are participating. Why not the other 300? I was just curious if you could.
That's a great question. In some cases, the district percentage of students eligible for free reduced price is low. So if 80 to 85% of your students are full pay, I mean, they have to pay for lunch and breakfast, we're finding they're less likely to come for breakfast. And so to provide a breakfast program obviously takes capital and takes, ongoing resources. And so if students aren't availing themselves of the breakfast, then it becomes a losing proposition financially.
Oh, that makes sense. Totally. Okay. Thank you. Thank you so much. Thank you, Madam Chair.
Thank you. Are there any more questions? Yes. Representative McCarty.
Been so good to me today. Thank you. Commissioner, just a very quick question. So in the budget, and it stays static all the way across on the after-school programs and the extended school hours, can you just, to the work group, just show where that funding goes for the extended school hours and the after-school program? Just curious in the difference.
Absolutely.
Thank you.
We'll share that information.
Thank
with
you so much. You can see I'm a proponent of the after-school programs.
And we appreciate that.
Thank you.
I think that's it. Thank you. And if you get back to your office and you just want to turn on the TV and watch us here for the next 17 hours, we will acknowledge you and everything else if you like. So thank you very much for coming before us, and we look forward to working in the subgroup. So thank you. Have a
Thank
good
you all very
afternoon.
much as well.
So to let everybody know who's going to be watching tonight, we are going to be doing a very unique situation. We are going to be dividing our testimonies in public hearing tonight. For those people who will be in person, they will be coming here to room 2C for their testimonies. For those people who are doing it online, they will be coming in by Zoom, and we will take care of them in a separate area, separate method of delivery, but it will be done separately from the in-person. We will be starting promptly at 4 o'clock for both entities. And I do ask that if people would like to work together so that we can reduce some of the numbers of people that we have testifying, so that maybe we could get home tomorrow morning. It would be totally appreciated from the members of the Appropriations Committee. So everybody have some coffee, rest up. We start in a little over an hour and a half. Thank you.